sala. Ok.
Perfecto, muchísimas gracias. Muy buenos días. Bon día, bonjour,
Thank
good
you. Good
morning.
morning.
Primero de nada,
First of all,
quisiera
I would like to
comentarles que este evento tendrá
tell you
traducción
that this event
simultánea en
is
español y en
being
inglés, así
translated
que
into
pueden
English
hacer
and
uso
Spanish, so you can use
de,
the
del icono que muestra, ¿verdad?
icon at the bottom of
El
the
mundo que
screen
aparece abajo en las pantallas
showing.
de Zoom. Hoy en día estamos casi todas y casi todos bastante
Most of
habituados
us are used to how to
a esta
connect with this,
modalidad,
so
¿verdad? A este tipo de webinarios. Em,
you know
En
how
nombre
to
de la
connect.
Organización
On behalf
Panamericana
of
de
the
la
Pan
Salud,
American
les
Health
damos la
Organization, we want to
bienvenida a
welcome
este
you to
webinario
this
Derechos
webinar
Humanos y Transformación
on human
Legislativa en
rights
Salud
and
Mental,
legislative
Human
transformation in
Rights and
mental health.
Legislative Transformation in Mental Health. Se trata de de
It's
parte de la serie de
a
webinarios
series of
Bases para el
webinars,
Cambio en la Salud Mental de
basis
las
for change
Américas.
in mental health in the
Este es ya el
Americas.
tercer webinario que
This is the
estamos
third
llevando a
webinar
cabo.
that we do.
Mi nombre es Carmen Martínez
My name is
Luciana,
Carmen
soy
Martinez.
asesora regional de
I am a
salud mental de
regional mental
la
health
Organización
advisor in the Pan
Panamericana de la
American Health
Salud
Organization.
y estaré
And
acompañándoles en el
I
día de
will
hoy para
be
moderar
with you today
este
and
evento.
chairing this event.
Comentar desde ya que la
Also, I'd like to
grabación
tell you that the
del webinario
recording of
estará
this webinar
disponible en
will
el
be
canal de
available
YouTube
on the YouTube
de la
channel
organización
of
y
the
también en
organization
la página
and
web
also
del
on
evento
the
a través del
event's
cual se han
webpage
registrado.
through where you connected.
Estaremos ahora colocando en el
And
chat
now in the chat,
links
we're
para que
going
puedan
to put all
acceder
the links so that
con
you can
facilidad.
access the recording if you wish.
Les vamos a presentar ahora la agenda
We'd
del
now
día de
like
hoy.
to talk to you about today's agenda.
Les invitamos a que nos
We invite you
acompañen durante la
to
próxima hora y
follow us
media.
for the next hour and a half.
Después de cada
After
presentación,
each
quiero comentar que se
presentation,
dispondrán de 5
we will
minutos
have
para
5 minutes
preguntas.
for
Esperemos que
questions.
tengamos ese tiempo.
Hopefully, we'll have the
Desde ya
time to
les
do that.
comento que por favor
And
utilicen el
I'd
espacio
like to
de
ask you to
preguntas y
please use
respuestas
the
de
Q&A,
Q&A que tenemos también en el
which is
Zoom.
also
Y
at the
por
bottom
otra
of your
parte,
screen.
pueden utilizar el
And
chat
you can also use the chat if you
más bien para
wish,
poder
but
comunicarse con el
mostly to
resto
communicate with the rest
de
of the
participantes, de
participants
panelistas y demás
or panelists.
en el
But for
evento y
questions, mostly the
prioricen que las
Q&A.
preguntas estén más bien
Make sure to put the
en el área
comments
de
or
Q&A
the
para que
actual
podamos
questions in the
organizarlas
Q&A
y
so that we
podamos
can
estar en la
organize them
medida de lo
and
posible
in as much as possible
intentando
answer
resolver algunas
them
de las inquietudes que
and maybe
estén
clarify some of the
compartiendo
concerns that may
con
arise
nosotras y
during
con
the
nosotros.
presentations.
Bueno, como pueden ver en
As you
la
see
pantalla,
on the
en la
screen,
agenda, estaremos
we will be
iniciando con unas palabras de
We
bienvenida.
will
Ahora daré
begin with
la
some welcoming
palabra al
remarks,
doctor
and in a
Renato
minute I'm going to give
Oliveira.
the floor to Dr.
Después
Renato
tendremos una
Oliveira.
presentación por
After
parte de
that, we'll
Olivia
have a
Cano
presentation
Godoy
by
de
Olivia
Paraguay.
Cano Godoy from
Después
Paraguay,
pasaremos a
followed
las
by
palabras de Leonor Cifuentes
remarks by Leonor Cifuentes
de Chile.
from
Desde ya
Chile.
disculpas
And we
porque se nos envió la
apologize
presentación
because
sin toda la información.
the presentation does not have all the
Y después
information in
tendremos
it.
dos presentaciones de
And then that will be
países
followed by 2 country
que
presentations,
serán a cargo.
which will
Ha
be,
habido un problemita
there's
con
been
esta,
a
con
slight
ahora mismo
problem,
vamos a estar corrigiendo y volvemos
and we're
si
going
acaso
to
a
be
compartir
correcting that soon
la
and
agenda.
hopefully share the agenda again afterwards.
Las
But
presentaciones estarán
the
a cargo
presentations will
de la
be
doctora
by
Joy Su.
Dr. Joy Su from,
Se nos ha quedado aquí por alguna razón
for
mal
some
grabada
reason,
la agenda.
the agenda was not
Parte de la
corrected,
agenda
and part of this
del
agenda
webinario
actually
pasado.
comes from the past webinar. So there's a problem
Quizás si
there.
le
We
das a
apologize.
Natalia a
Maybe,
refrescar, porque sí que
Natalia, if you
la
refresh,
presentación bien
because,
Dame un segundo. En el
yes, if
drive
you
y
give
por
me a
alguna
minute.
razón se ha quedado
I know that it's in the
mal,
drive and maybe it was just
quizás al abrirla mal grabada. Sí.
recorded poorly.
Entonces, como les
But
decía,
anyway,
la
as I
doctora
was
Joy
saying,
Su de
Dr.
Barbados.
Joy Su
Después
from
tendremos una
Barbados
presentación
will
por
make a
parte
country
del doctor
presentation,
Gerardo
followed by
Peña
Dr. Gerardo Peña
de
from
México.
Mexico,
Y finalizaremos con unos
and
comentarios
we'll end
finales
with
de
some final
Olguer
remarks by
González de la
Olguer
UPS también.
González from PAHO.
Ya, dame un momento, por favor. Estoy refrescando. ¿Quieres que comparta yo, quizás?
No, you want me to share? No, I've got it.
Disculpas por los problemas
We
técnicos, ¿verdad?
apologize for the technical
Que en
problems.
ocasiones tenemos.
Sometimes these are inevitable.
Ahora sí que está refrescada con
Okay,
toda
now
la
we have
información.
the correct
Así
information,
que bueno, para que puedan
just so
tener
that you
claro quién
can
nos está
see
acompañando en el día de
who's with
hoy.
us today.
Por lo demás,
Other than that,
quisiera que avanzáramos con
let's
dando la bienvenida para esas
welcome
palabras
you.
de apertura
So we're
de
going to give you
Renato
the
Olivera
floor to
Sousa, que es
Renato
nuestro
Olivera
jefe de
Sosa,
unidad de
who's
salud
our
mental y uso de
head of the
sustancias de
Mental
la
Health
Organización
and
Panamericana de la
Substance
Salud.
Use
Adelante,
Chief in the Pan American
Renato.
Health Organization. Renato,
Muchísimas
please. Thank
gracias,
you very
Carmen.
much,
Buenos
Carmen.
días a
And
todos
good
que
morning
están
to
acá
all
con
of you.
nosotros. Yo voy a
I
hablar
am
en
going
inglés.
to speak in English.
Thank you, colleagues, for joining us today in this webinar, which is very important for us. As you are aware, the webinar is titled Human Rights and Legislative Transformation in Mental Health. And as we gather here today, we really embark on a journey to explore critical issues surrounding mental health and human rights. At the Pan American Health Organization, our commitment to supporting the mental health needs of the Americas region is unwavering. And it's also grounded in the fundamental rights of every individual. Despite progress, stigma, discrimination, and human rights violations unfortunately persist, and they affect those with mental health conditions and psychosocial disabilities. And that's the reason why we work together with countries in the Americas for the integration of human rights-based mental health principles in all pertinent policies and sectors. Today, our focus sharpens on fostering a collective dialogue, encompassing the critical review and challenging implementation of laws, policies, and regulations governing mental health services in the region. We are eager to delve into enlightening practices from countries such as Mexico and Barbados, showcasing exemplary approaches. Moreover, we are honored to hear directly from an individual with lived experience, offering invaluable testimony on her experience in mental health services. Their insights can really help us find a way to make mental health services better. The reality is also that we see in the region of the Americas a wave of changes and improvements in mental health laws. But we also would like to see practices changing, practices that improve quality of care and respect and protect people's rights. Let me extend our gratitude to our esteemed panelists for their invaluable contributions. And we are grateful for the steadfast support from our offices all over the Americas, ministries of health, and other organizations. Your active participation, and we have a good number of people here with us, more than 200 last time I checked. Your participation here is crucial as we really embark on a collective movement of change. Without further ado, let's engage in this meaningful dialogue, learn from one another, and work towards a future where mental health and the protection of people's rights is a priority for all. Thank you for being part of this important discussion, and I really wish all of you an excellent webinar. Back to you, Carmen. Thank you.
Thank you very much, Renato, for your nice and encouraging words. Y con esto nos gustaría pasar ya a la
Now we'd
primera
like to go to the first
presentación
presentation
por parte de Olivia Cano
by
Godoy.
Olivia
Ella es de
Cano Godoy
Paraguay y es
from
integrante del
Paraguay,
colectivo
who's a member
Non-BI,
of
usuarios y
the
usuarias de servicios
non-BI
de salud
users
mental
of mental health
en
services
Paraguay.
in
Ella
Paraguay.
nos va a estar
She's going to
hablando
talk to us
sobre su
about
experiencia y
her
sus reflexiones
experience
sobre el tema
and
que
her
estamos
thoughts about
tratando
this
hoy. Así que
subject that we're
muchísimas
discussing
gracias,
today. So
Olivia, por
thank you
estar
very
aquí
much, for
con
Olivia,
nosotros.
for
Adelante.
joining us here today, and you have the floor. Olivia.
Olivia, ahora creo que te estamos
Olivia,
escuchando,
I
pero no te
believe
estamos
we hear
viendo.
you,
No
but we
sé
don't
si.
see you. No, I'm
Ya,
sorry. We
sí,
do not hear her. Okay, now we hear her.
Perfecto.
buenos días. Sí,
With very bad
Adelante,
sound,
Olivia.
I must say.
bueno,
Her sound is
gracias.
very bad. Thank you.
Bueno, más allá
And
y más acá del marco legal.
aside from the legal
Si bien
framework,
el marco legal gira
I'm
en
sorry, her
torno a
sound
los
is
servicios de
terrible.
salud mental,
We're going to talk
su
about the mental health
cumplimiento,
services
impacto y
and
alcance
the
puede ir más allá de los
compliance and
servicios.
scope, which must go beyond the
Remitiéndome a mi
services.
experiencia como
I'm
paciente
going to talk
internada
about
en
my
una institución
experience
psiquiátrica,
in a psychiatric
pienso en qué
institution.
pasa después.
And I think what happens
Él y la
after,
paciente en etapa de recuperación,
during
aceptación,
the
necesita
recovery
reinsertarse
stage
a
and the
una comunidad, a
reinsertion
una
into a
familia, a un hogar,
community,
al estudio
a
y al
family,
trabajo.
or a
Por
home,
esto es que en
study, and
Paraguay
work.
la ley
In Paraguay,
número
therefore, the
7018 de
law
salud mental,
1718
en
of
el artículo
mental health in
19,
Article
habla de
19
la duración de la
speaks of the
internación y de las
duration of
medidas
the
para la
internship or the hospitalization and
desinstitucionalización
measures
progresiva.
for progressive
Esta ley contempla en el
dismissal of the
artículo
hospital.
8 que el
I'm sorry,
paciente sea
but her sound is
acompañado antes,
terrible.
durante y
It
luego del
states
tratamiento
that the
por sus
patient must be
familiares o
supported by the
tutores
family
legales.
members or the
Pero
legal
esto no
guardians
garantiza que el
before, during,
paciente
and after, but
tenga
this
un
does
lugar
not
a donde
guarantee that the
volver
person has a place to
y
go to
familiares
afterwards,
que la acompañen
or
en la
family
etapa de
members willing
recuperación
to support
aceptación.
them during the recovery
En la
period.
realidad,
In
quienes
fact,
pasamos una internación
those of us
psiquiátrica
who have
tenemos grabada en
had these
nuestra
problems
frente
have our
la palabra
forehead,
loco o loca.
the
Este estigma persiste
recorded on
por
our
más que
forehead,
hayan
the
pasado
term
años desde
crazy,
la última internación
despite the fact that
y volver a
we have
estudiar
spent
para
years
una persona que estuvo
after we've come
psiquiatrizada es un
out.
gran desafío.
And
E
it's a difficult
insertarse o
process to
reinsertarse en el mundo
reinsert or
laboral
insert themselves
también
in
es
the labor
difícil.
work.
En el caso de Paraguay,
In
anterior
Paraguay,
a la
I'm
ley de
really,
salud
really
mental,
sorry. The
esta
interpreter
fue la ley,
apologizes, but
la
the,
ley
the
número
sound is terrible. We're
2479
losing half of what she's saying.
del
You just
2004,
mentioned a law
que
of
establece la
2004, which
obligatoriedad de la
speaks
incorporación
of
de personas
the
con discapacidad en
incorporation of
instituciones
persons with
públicas. Por
disabilities
un
in
lado, una
public
ventaja, pero
institutions.
por otro lado,
It's an
cuando los
advantage
demás
on the one hand,
funcionarios o
but when the
funcionarias
other officers
saben que alguien en
know that,
grupo de discapacidad
I,
psicosocial,
I
el estigma
apologize,
sale a
we're
flote y
losing
en
her.
muchos
We're
casos la
losing half of
persona
what
con
she's saying.
discapacidad psicosocial
In this
sufre
case, the person
discriminación.
with a
Podemos
psychosocial
tener una ley bien
disability suffers
elaborada, podemos
discrimination. We
tener
may have a good
personal
law,
de salud
we may
capacitados
have
humanos, pero si
trained
nos limitamos a los
staff,
servicios
but
de
if
salud
we
mental,
limit
estaremos
ourselves to the
abandonando
mental
a su
health
suerte
services,
a personas
we're
en
leaving
proceso
these
de
people
recuperación que por no contar con
uh,
espacios
who do
comunitarios,
not have the necessary community spaces.
familias, estudios, trabajo, donde
Interpreter
integrarse,
apologizes, the
podrían
sound
retroceder
is
en su
being lost,
proceso y volver a
and the
internarse.
person,
El
because of what's
artículo
happening, may
32
return, I
del
think is
segundo
what she's
párrafo
saying.
dice, los
And somehow the
programas de
second
promoción y
paragraph says that the
prevención
promotion and prevention
deben ser de
programs
fácil
must
accesibilidad
be
y difundidos a
easily
toda la
accessed
población para que tengan
and must be known
conocimiento
by the
de los
community and
mismos,
the population so that they know what
ya
is
que es la
in these.
población y las
Since the
comunidades
population and
las
the
que
communities are
recibirán
the
a
ones who
quienes
will
transitan
receive
hacia la
those
reinserción
who
social.
are hoping to
En
reinsert
esta
themselves
promoción
socially.
y prevención es fundamental el rol y
In
la
this
responsabilidad
promotion
de
and
los medios
prevention,
de
the
comunicación.
role of the media is
Por eso es
fundamental.
necesario capacitar
It's important to
a los
train
y las periodistas en la utilización de
journalists
un
in
lenguaje
how to use
respetuoso
a
y
respectful
un
language
trato digno
and a
en las
decent
noticias que
treatment
conciernen
in the
a
news
quienes somos usuarios, usuarias,
that may affect
ex
those of
usuarios
us
y ex
who are
usuarias del
users or
servicio de salud
former
mental.
users of the mental health services.
Cuando se dice a toda la población para que tengan
When we talk about
conocimiento,
all the
hay que buscar
population
los
and that
medios
they
para
have the knowledge, we have to
sensibilizar y
find ways to make
hacerle
them aware of
comprender a
these
la población
and
que cuando se habla
understand
de salud
that
mental,
when we speak of
no es
mental
solamente
health,
asunto de locos y locas,
it's
no se
not just a
restringe a
person
los
who's
usuarios y las
crazy,
usuarias.
it's a person, I'm sorry. We've lost her.
Hay
Now
temas
we've
como el
lost her
maltrato
completely.
familiar, el maltrato escolar,
There's
el
abuse at
control
school,
del estrés,
in the
se
family,
relacionan a la salud mental, pero se
and
los ve como
it may be due
problemas
to the mental
internos
health because
de los
it's seen as
contextos
an
donde se
internal
desarrollan.
problem.
Por esto creo que es necesario
That's
ver a
why I
que no es
think
una
that
cuestión
we
individual
must
que nos
realize
atañe
this is
a
not an
todos y a
individual
todas.
thing. This is something that affects all of us.
Disculpa, Olivia, que te,
¿Se
que,
We
escuchó?
que
apologize,
te pare un
Olivia.
momentito.
Let me interrupt
Parece
you
que
for a
estamos
minute, but
teniendo
it seems we're
algunas
having a lot
dificultades
of trouble
para
trying to follow
escucharte
you.
bien.
We are not hearing you
¿Qué tal
well.
si pruebas a
Could
cerrar un
you
poquito la cámara? A ver si
maybe
mejoramos
turn off your
el audio
camera
y
and
Ah,
después
see
la
ya.
if
vuelves
the
a prender.
audio improves, and then turn it on
Si te parece, lo
afterwards?
probamos.
Could we test that and see if you turn off your camera to see if your audio improves?
Ya. ¿Y quieren que empiece de
Do
vuelta?
you want me to start from scratch?
No, yo creo que
No,
¿Quieren
no,
que
no.
empiece de vuelta?
si alguien
Do
me
you want me
puede
to start from
confirmar, yo creo
scratch?
que yo he
No,
entendido
I
bien.
think
Han
that
sido
we've
los
more or
últimos
less been able to
segundos
follow
los
you.
que estaba más
It's
complicado.
been only in the last few sentences that we missed most of what you said.
Si me puedes repetir
Can
que
you tell me where you
si
want me
Olivia,
to?
que lea de vuelta al
con
comienzo.
Olivia, just
con que
continue.
nos retomes el final de lo
Just
que habías
continue to
dicho
the end
sería
of what you'd
suficiente.
said. That would be enough.
Solo lo último no se
Just the
escucha.
very last
Ya.
thing you said.
Bueno.
Okay. So,
Bueno, por lo expuesto, creo que es fundamental en la ley
what
paraguaya,
I've
el
said
artículo
in the
32,
Paraguayan law, Article
que en
32,
el segundo párrafo dice los
which is the
programas de
second paragraph,
promoción y
which says that the
prevención
promotion and
deben ser de
prevention
fácil
programs must be
accesibilidad y
easily
difundidos a toda la
accessed and
población para que tenga
disseminated throughout the
conocimiento de los
population so that
mismos,
they can know
ya que
of
es
their
la
existence, because
población
it
y
is
las
the
comunidades
population and the
las que
communities who
recibirán
will
a
be
quienes transitan hacia la
receiving those
reinserción social.
who are returning to society, are reinserting themselves in society.
¿Y ahora se escucha?
Can you hear me now?
Se estaba
We
escuchando
can
hasta
hardly
ahora,
hear her. Now we
pero ahora
barely hear
paramos
her.
de escucharte, Olivia. De repente se escucha como muy lejos.
We
No sé si ha habido algún cambio en
barely
el
hear
audio.
you. I don't know if there's been a change in the audio.
Creo que es fundamental en la ley promoción
The
y
interpreter
prevención.
apologizes, but she cannot hear.
Hola, ¿no se escucha, Carmen?
Now can you hear me, Carmen?
Ahora sí,
Yes,
Olivia,
now
adelante.
we're hearing you, Olivia. Go ahead.
Bueno.
Okay.
Por lo expuesto, creo que es fundamental en la
From
ley
the above,
paraguaya,
I
el
think that in the
artículo
Paraguayan
32,
law in
porque el
Article
segundo
32,
párrafo dice
in the second paragraph, which states, she turned her microphone off, I believe. She muted herself.
el micrófono acá, bueno, voy a repetir. Por lo expuesto, creo que en la ley paraguaya, el artículo 32,
She's
que en el
repeating
segundo párrafo dice los
the
programas de
second paragraph, Article
promoción
22, promotion
y
and
prevención
prevention
deben ser de fácil
programs
accesibilidad
should
y
be easily
difundidos a toda la
accessed,
población para que
disseminated
tenga
throughout the
conocimiento de
population so
los
that they
mismos, ya
know
que la
of their
población y las
existence, since the
comunidades las que
population and the
recibirán a
communities
quienes
are the ones who will
transitan hacia la
receive those
reinserción social.
who are
En esta
returning to
promoción y
society. In
prevención
this promotion and prevention,
es fundamental el rol de la
the role
responsabilidad de los medios de
and
comunicación. Por esto es
responsibility
necesario
of the
capacitar
media is
las
important,
periodistas
and
en la
that's why
utilización del
journalists should
lenguaje
be
respetuoso y un
trained
trato
in the
digno en las
use of
noticias que
respectful
conciernen
language
a quienes son
and
usuarios, usuarias y ex-usuarios y
in the
ex-usuarias
news of
de
those who
servicios de
are
salud mental.
users of the mental health
Cuando se dice a
services.
toda la población para que
When we
tengan
talk about all the
conocimiento,
population
hay que
and
buscar los medios
have
para
them be informed, we have
sensibilizar
to find ways to
y
make them
hacerle comprender a
aware
la población que
and
cuando se habla de
understand
salud
and make them
mental,
understand that
no
when
es
speaking of
solamente
mental
asunto de
health, we're
locos
not
y
just
locas,
speaking of
no se restringe a
crazy
los
people.
usuarios,
It's
las
not
usuarias,
limited only to the
los servicios de salud
users
mental y el
or the
personal de
mental
salud.
health services or
Hay
the
temas como el
mental
maltrato
health
familiar,
staff. There's
el
problems like
maltrato escolar,
family
el acoso
abuse,
laboral
school
y el estrés
abuse,
que se relacionan a la salud mental,
labor
pero se
harassment,
los
all
ve como
related to mental
problemas
health, but they're seen
internos
as
de los
internal
contextos
problems
donde se
within the
desarrollan.
context where they're
Por esto
being
creo que es
developed.
necesario ver a la salud
That's why I
mental
think
en
it's
las
important to
diferentes
see mental health
dimensiones y
in
darnos
its
cuenta que no es
different
una cuestión
dimensions and realize
individual,
that it's just
que
not
nos
just an
atañe a
individual thing
todos y a todas.
that it's something that affects
Muchas
all of
gracias.
us. Thank you.
Muchísimas
Thank
gracias,
you very
Olivia.
much,
Creo que
Olivia.
aunque se nos complicó un poquito
Though
el
the
audio, creo
sound
que
was a
hemos
little
logrado al final
complicated,
poder
I think we were able
seguir
to
muy bien
follow
lo
you
que nos compartías. Yo creo que
closely.
la
I believe
experiencia
that
propia de Olivia
Olivia's
es
experience
realmente
is
impactante y
quite an impact, and
desafortunadamente
unfortunately,
sigue siendo una
it
experiencia por la que
continues
pasan
to
aún
be
muchas
something that
personas
many people
en la región de las
in the
Américas y
region
en
of
el
the
resto del
Americas are
mundo.
living with,
Ella
and in the
además
rest of
nos
the world,
comparte esas
actually. She also
reflexiones, ¿verdad? Y
talks
el
to us
análisis
about
sobre la importancia que
how
tienen la
important it is
capacitación, la
to train
sensibilización de la
and
población
to
y las reformas
make the
legislativas.
population aware
Muchas
of the
gracias, Olivia,
situation
de
and all of
corazón,
the legislative
por
reforms. Thank you,
compartir este
Olivia,
espacio
for sharing
con nosotras y
your
nosotros.
ideas with us.
Creo que hemos tenido alguna
I think that
pregunta por aquí. Vamos a
we have a
aprovechar
question here, so
para
let's take
hacerte
advantage
una de
and
las preguntas
ask you
que
one of
se
the questions.
compartían. Y sería, ¿cuáles son los
What
avances en relación
progress
a las
have you
secuelas del
seen
estigma
in
en la
the
salud mental de
sequelas
las
of stigma
personas?
in the mental health of
¿Y cómo
persons?
crees que podríamos
How do you think that
abordar
we could
esta manera,
approach
esta
this
problemática de manera
problem
conjunta? No
together?
sé si queda clara la pregunta,
I
Olivia.
hope that question is clear.
Sí, la secuela del estigma,
The
dijiste, ¿verdad?
sequelas and
Sí.
stigma, you said? Yes, correct.
Sí, bueno,
Well,
bueno, yo creo que
I
las
think that,
principales secuelas, bueno, que decía al comienzo de
as I said at
lo
the beginning of my presentation,
son la
the main
reinserción
sequelas
tanto
or the main problem is the
al
reinsertion.
estudio, volver al colegio o a la universidad,
We cannot hear her. Sound is
también
terrible.
laboral. O
We've
sea, yo creo que
lost,
esos son, bueno,
we
son
just hear just
a nivel social, son
noise.
como las
She says
principales
now that socially,
secuelas del
those
estigma.
are the main
También
sequelas
a
and stigma, but unfortunately we weren't able to hear what she said.
pasa también a nivel familiar,
And also in the
como las
family,
familias ya están como hacia la persona, hacia su familiar, o el otro extremo que es la sobreprotección.
are
O sea,
either
ninguna de las dos
overprotective
formas
or
ayuda
try
realmente
to ignore, and
a la
neither of
persona a
them are helpful
reinsertarse a
for the
a la misma
person
familia.
to assist them to reinsert themselves in the
Otra
family.
secuela también del estigma es
Another
también el
sequela
autoestigma
is
que
the
la
self
persona que pasó
esteem of the person who
por,
lived that experience,
especialmente por la internación psiquiátrica, ya queda
especially
como
if they've been
con un
in a
miedo
psychiatric
a
hospital. There's
poder
always
hacer
that
las
fear
cosas,
of being able to
si va a
do
poder luego
things
estudiar de vuelta,
and
si va a
wonder
poder
whether
trabajar, si va a poder formar
would
una
be able to
familia, tener
study or
hijos.
have a
O sea,
family or
también
have
es un
children.
autoestigma
The self-esteem
que queda
is
también
something that's very
cuesta
seriously
mucho. O sea,
affected.
yo pasé por un proceso de taller de
I went
autoestima, ir a
through
la
a
psicóloga,
very
o sea, fue un
difficult
proceso
process. I
largo,
had to go to a
proceso
psychologist. It was a very long process
posterior a la
after
internación.
I was in the
Proceso largo
hospital. I was hospitalized.
para poder llegar hasta acá.
It was a long process for me to come this far. We've lost her again.
Olivia, te escuchamos bien hasta
Olivia,
ahora,
we
pero
were
ahora
hearing
dejamos
you
de
okay,
escuchar.
but we're no longer hearing you.
Ya no se te
Son
escucha,
repetidas de
Olivia.
vuelta
We
en las
can no
redes
longer hear
sociales.
you.
¿Cómo?
I'm sorry?
Estuvimos como unos
We
segundos sin
spent a
escucharte. No sé si
few
puedes
minutes without hearing
retomar la
you.
última idea, por favor.
Maybe if you can repeat your
Sí,
last idea. No, what I was
que
saying was that
justamente eso que decía sobre los medios de comunicación,
what I mentioned about the media,
creo que es muy importante, ya que todas las noticias de los medios enviadas,
that
por
was
eso es
very
importante, muy
important
importante
because
como los medios, como los periodistas
the
tratan
journalists have to learn
a-
to treat, and we've lost her.
Olivia, disculpa, pero dejamos de
I apologize,
escucharte. Nos
Olivia,
quedó
but
claro que nos estabas
we
mencionando la
could no
importancia que
longer hear
tenían
you,
los medios
but
de
we believe
comunicación,
you were talking about the
¿verdad?
importance of the
En
media
estas cuestiones de
in
estigma y
these
demás.
aspects related to stigma and what have you.
Si les parece, vamos a
If
seguir
you
avanzando
agree, let's continue.
y con gusto si pudiéramos al
And
final
maybe at
y
the
mejora
end,
la
if we
conexión,
were
aún
able to
podríamos tener
improve the
algunas
connection with
palabras
Olivia, we might ask
finales.
her to
Gracias,
say some
Olivia,
final words. Thank you,
por tus
Olivia, for
aportes.
your
Ahora
contributions to
vamos a
this.
continuar
And now we're going to continue
con la
with
presentación de Leonor Cifuentes.
Leonor
Ella es abogada,
Cifuentes'
licenciada
presentation.
por la
She's an
Universidad de
attorney,
Chile,
graduated in
máster
the
en
Chilean
Dirección y Gestión
University,
de
a master
Bienestar
in
Social y Servicios
social welfare
Sociales,
and social
diplomada en
services,
Gestión de Instituciones de Salud.
management of
Formó
health
parte como
institutions. She was
experta
part,
designada por
as
el
an
Gobierno de
expert
Chile
appointed by the
del
government of
Comité ad
Chile,
hoc para
of
la
the ad hoc
elaboración de la
committee for
Convención
the
Internacional de los
development of
Derechos
the
de las
International
Personas con
Commission on
Discapacidad de las
persons with
Naciones Unidas
disabilities
durante
in the
los años
United Nations
2003 a
from
2006
2003 to
y lideró la
2006,
elaboración del
and led
proyecto
the
de la
development
actual
of
Ley
the current
20422 sobre
law
inclusión social de las personas con
422 of
discapacidad
the
y
persons with
participó como
disabilities,
asesora legislativa
participated as a
durante
legislative
su discusión
advisor
parlamentaria.
during its
Cumplió
parliamentary
funciones de
discussions.
coordinadora
She
ejecutiva
was
de la
a
Comisión Nacional
executive
de
coordinator of
Protección
the
de los
National
Derechos de las Personas con
Commission
Enfermedades
of Protection of
Mentales del
Persons with
Ministerio
Mental
de Salud,
Disabilities in the Ministry of
órgano de
Health,
revisión creado por la
a
Ley
review body
20584.
created by the law
Actualmente,
2584. And
Leonor
it's currently
se desempeña como consultora en
a
legislación en el Centro
consultant on
Colaborador de la
legislation in the
OMS para el
PAHO
desarrollo de
WHO
servicios,
Center for the
capacitación e
Development of
investigación en
Services
salud
Training
mental de la Escuela
in
de Salud
Mental Health in the
Pública
Public
de
Health
la Universidad
School
de
of
Chile
the
y
Chilean
cuenta con
University,
amplia
and
trayectoria como
has a long
docente en materia
history
de
as a
protección de
teacher
derechos humanos de las
in
personas
human
con
rights protection of
discapacidad
the persons with
y
disabilities
justicia constitucional.
and
Así que
constitutional
sin
justice.
más, quisiera darle la palabra
I'd
a
like
Leonor.
to
Adelante.
call on Leonora.
Muchas gracias, Carmen,
Thank you
por
very
la
much, Carmen.
presentación. Y muchas gracias por
Thank
la
you for your
oportunidad
introduction and thank you for the
compartir y
opportunity
debatir y escuchar
to
testimonios tan importantes
be
como
here and share
el que acaba de
the
hacer
different people and the
Olivia.
witness we just received from Olivia.
Mi presentación
My
la he
presentation
titulado
is
Legislación en Salud
called
Mental
Legislation
con
in
enfoque
Mental
de
Health
derechos humanos.
with a
Y
focus
aquí
on human rights.
quiero recordar
And
lo
here
que
I want to remind
planteaba
you
el anterior relator
of
especial
what was mentioned by
de
the
derechos de las
former
personas
special
con
rapporteur
discapacidad, Gerard
of the
Quinn,
rights of the people
y ese
with
momento de priorizar
disabilities,
las
Mr. Quinn,
libertades y
which
dar
is that we need to
vida a los
prioritize
derechos.
needs and give true life to our
Tradicionalmente,
rights.
y
Traditionally,
lo acaba de relatar en su
and we just heard from Olivia
Olivia, y
and
también
her
lo
witness,
señaló el doctor
and it was also
Oliveira,
mentioned by Dr. Oliveira,
la legislación de salud mental ha
mental
estado
health
más
legislation
enfocada
has been more focused on
garantizar procesalmente establecer algún
guaranteeing
tipo
or
de
establishing
garantía
some kind
para
of
aquellas
guarantees
restricciones
for the
a las libertades
restrictions
y derechos
on
fundamentales que la
liberties and
propia ley
basic rights
autorizaba
that the
en
law
pos de los tratamientos de
authorized
salud mental.
for
Por otro
mental health
lado, su enfoque
treatment.
era
On the other
meramente
hand, the
biomédico
focus was just
y también
biomedical
escuchamos
in nature.
recién
And we
como
also heard
problemas
how
individuales, es decir, con un
individual
absoluto
problems,
desconocimiento
in
de
other
los
words, there was
determinantes
lack of
sociales de
knowledge
la
of
salud,
social determinants of health.
con una denegación absoluta
So
de
there
la
was total
capacidad
denial
jurídica,
of the
prácticas
legal
coercitivas,
capacity,
discriminación,
the
todo
fact
lo
that there
cual
was discrimination
producen
against
una afectación
people, which
grave
leads
de la
to
dignidad
serious
de las personas y generan este estigma que
problems
acabamos
for the
de escuchar.
people with disabilities, and they
En
generate
el
issues
enfoque de
of
atención en la
lacking
comunidad, ese
in
que llevamos
treatment
30
by the
años
community. I know we've been
desde
30 years
la
or 30 years
declaración de
have gone
Caracas,
by
que es un
after the
consenso
Caracas
en el
Declaration,
sentido de
which was a
que
consensus in the
el
sense
centro, el
that
eje
the
de la atención
core
de salud
for
mental está
the
en la
focus for
comunidad,
mental health
servicios de
is
proximidad,
in the
servicios
community.
prestados en la comunidad
Services
y
provided at community
una
level are the
persistente
core,
falta de
and there was
recursos
persistent
para
lack of resources
cubrir
to
las brechas que son
cover or to
bastante
bridge the
significativas
gaps
en la
that are
atención de salud mental y que
significant
se
in mental health care,
visualizaron
which
dramáticamente
were seen
estos años
dramatically
posteriores
in the
a la
past
pandemia.
few years after the pandemic.
La Convención
So,
sobre
the
Derechos de las
Convention
Personas con
on the
Discapacidad
Rights of People with
eh,
Disabilities
concluye o inicia una nueva etapa
starts a
lo que es
new
este camino
stage
y este tránsito a los
on
derechos.
this journey
Las
toward
enfermedades
securing
mentales,
rights.
aunque incluso con un
Mental
lenguaje muy
illness
estigmatizador,
and
que era el
using
que se usaba
stigmatizing
comúnmente
language,
en la
which
época,
was the one that was used back then at
motivó el
that time,
sistema
led
internacional de protección
to the international
de los
protection
derechos
system that
humanos
protects
se
human
haya
rights
preocupado
has
desde
become
el año
involved and
71,
concerned
que
starting
comienzan
in the
las
year
primeras
1971, where
declaraciones de
the first
protección
declarations to
que
protect the rights
señalan
of people with
en
disabilities
síntesis
to
que las
uh,
personas con enfermedades mentales
point out
tienen
the
los
fact that
mismos
people with
derechos humanos
mental
que el resto
illness
de
have
las
the same human
personas.
rights as the same
Y
as
ahí
the rest of
tenemos
the
un
people.
tránsito
And so
hasta
we have
llegar el año
then we
2006
started
a la
our
aprobación por la
transition to the
Asamblea
year
General de
2006
Naciones Unidas
when
de
the
la
General Assembly of the
Convención de
United
Derechos
Nations
de las
approved
Personas con
the
Discapacidad,
Convention
que
of
constituye un
um,
hito
for people
en
with disabilities,
materia de
which was
derechos humanos. Un hito
a
en el sentido
landmark,
que
a
cambia el
milestone,
paradigma
because it
biomédico
changed the
por un
biomedical
paradigma de
paradigm
derechos humanos,
for a
que
paradigm
es
focused on human
consecuencia
rights.
del
And
paradigma
this came from
social
the
y de
social paradigm as
comprensión de la
well as
discapacidad, no
understanding
como
disability,
un
not
problema de la
as a
persona que
problem
presenta
of the
esta
person
discapacidad,
who
sino
has the
que
disability,
como un
but
problema
it
que
is
está en las
presented as a
barreras del
problem
entorno
that
que
lies in the barriers
imposibilitan
in the
o
environments
restringen la
which
funcionalidad de las
restrict
personas.
uh, functionality by the
Hoy
person
día tenemos el desafío, y
with a
como lo decía el
disability.
doctor
Today, our
Oliveira, estamos
challenge, and as
presenciando
Dr. Oliveira was
una
saying,
ola
we are
de
witnessing a
reformas
wave
de las
of
leyes de salud
reforms
mental
of all
y
the
la
mental health
OMS en
legislation,
conjunto
and
con
WHO
la
together
Oficina del Alto
with the
Comisionado de
um,
Naciones Unidas
High
han
Commissioner of the
establecido
United
ciertas
Nations have
orientaciones que
established certain
constituyen
guidelines
una
which
guía para
are a set of
la
guides or
legislación en salud mental,
directives
que
for
una
mental
de
health
las primeras
legislation.
recomendaciones
One of the
que se
first
establece es que
recommendations that
ojalá
are
no
set forth
existan
as that
leyes especiales de salud
hopefully
mental,
there will
sino
be
que
no
las
special laws
prescripciones
for
para la
mental health, but
atención
that
en salud
the
mental estén en las leyes generales de
that
salud.
the general health
Eso, por ejemplo, es lo
legislation
que ha
includes mental
hecho
health. And this
México,
is what
que ha
Mexico
modificado su
did.
ley de salud,
They changed
introduciendo
their
un
health
capítulo especial respecto a la
laws,
atención en
and they
salud
have
mental.
included a
Y
chapter
hoy
on
día el
mental health.
desafío
And
de las
today, the
legislaciones
challenge
que
for all
tenemos
legislations
avances
everywhere is that
importantes
the important,
es
significant
adoptar
progress has been made,
definitivamente
and
y
we need
consolidar
to
este
adopt
enfoque
and
de
consolidate
los
this more
sistemas de salud mental
wholesome
basados
approach
en derechos, basados
using
en
mental health
en la comunidad,
approaches based
erradicar
on
la
the
discriminación
community,
y la coerción,
eradicating discrimination and
promoviendo la inclusión
coercion,
y la
promoting
participación de los expertos
inclusivity and
por experiencia.
participation by
También
experience, using the
la
experiences from
legislación
experts.
debe
Also, the
instaurar
legislation
sistemas
should
de
set
rendición de
forth
cuentas
uh,
y desarrollar un modelo de
systems
atención
where
basado en la
we have a
recuperación.
model
Aquí
of
tenemos un
healthcare
ejemplo
that is based
concreto
on
en la
recovery
legislación
and where there is
de
accountability.
Argentina,
There
que
is an
señala
example
que
in the
ninguna
legislation
condición de
from
salud mental
Argentina, which
es
says that no
inmodificable,
condition of
como
mental health
se
is
ha
unchangeable,
tendido a creer, como era parte
which used to be the old way
de
of
la práctica
thinking.
médica
And it was part of the medical
anterior
practice,
a
medical
este modelo
praxis,
de derecho.
which was before using
Y
the model that is
priorizar,
based on human
dicen
rights.
las
And
orientaciones, la
according to the
atención, los
guidelines,
apoyos
priority should be
sobre
granted
el
to
control
supporting
acerca del desempeño o de las conductas de
supporting
las personas
people
afectadas.
with
También
their
este modelo
behaviors.
requiere,
People
y
who
al
have the
igual
disability
como
should be
cualquier
supported. And
atención en
this
salud, en
model, as
que
any other
ya
type
no
of
hablamos de
of
pacientes, sino
healthcare,
que
we
la
don't talk about
persona
patients
es
anymore, but about
protagonista de su
the person.
recuperación.
The person
Por lo
is
tanto,
in
eso
charge of their
requiere
recovery,
el
and
empoderamiento
therefore it
y una
we need to
participación
empower the person,
activa
and
en
it needs
todo
the
el
active
proceso
participation of
de
the
salud.
person in the whole
Aquí
process
el
for
cambio
their health care.
más
So
importante
the
es el
most
cambio
significant
paradigmático,
change,
y a
the
mí,
paradigm
que me
shift,
tocó
so to speak,
participar en el
and where
proceso
I
de
participated
negociación,
in
y
the
debo
negotiation
reconocer que como
process,
abogado
and I have to acknowledge that as a lawyer, all of this changed my point of view, what I had learned during my years of education, what we had learned as lawyers in law school, is the sense that people with mental illness are subjected to an interdiction system, which is what is truly to be understood as civil death. They cannot have their own rights and they cannot advocate for themselves. Article 12 acknowledges the active participation for movement for people with disabilities, people who have been abused, people who suffer from the stigma because they were patients and users of the mental health system. And this was determinant to leading to the change. The legislation acknowledges full legal capacity of everybody with a disability in under all life circumstances, under all under all situations. There are no exceptions. There are no exceptions whatsoever in terms of mental health care or in general health care at no level in a person's life course. The convention mandates all states to provide support so that decisions made by a person may become fully effective. So, because if they don't get the support, the letter of the law is dead, because people are many times under no condition to decide for themselves. And so we have to assume that every time we make a significant decision, we are looking for support. We look for experts, people who know more than we do. And the same thing is required, of course, when we are vis-a-vis mental health care with people who have mental disturbances. And therefore, it is an obligation, and the state is mandated to provide this support. And also, it is required to have safeguards to guarantee respect of the rights of the person, their will, and their preferences. So here, there's no room whatsoever for the person's higher interest. Someone could say, well, this is not the right decision for this person. It's not effective. It is valid and we need to respect, and it is worth our respect. So what is operative here is the guarantee of risk. We all have the right to make mistakes. We all learn from our mistakes. Also, Article 12 includes the respect of the capacity, which increases over time with children. We need to listen to children regarding their health decisions. Big progress had been made on this from the bioethics approach, where we needed to listen to the adolescents, minor adults. They needed to be listened to regarding their decision making. But here, this is enshrined and it is legally binding. This need to listen to children without prejudice of the fact that the decision is based on what the parents say or whoever is their legal guardian. So this full legal capacity requires a review of the current legislation regarding criminal responsibility or liability and the unimputability of people with mental disturbances or who suffer from psychosocial disturbances or intellectual disability. People who commit a crime and who have some mental disability, in general terms, understood as psychosocial intellectual disability. Today, they are not punishable but
y son
they
sometidas
are,
a
it is
cumplir
mandated that
tratamiento
they
forzado
needed
o
to be
medidas de
treated,
seguridad,
or
medidas de
that
encierro en unidades
security
diversas
measures
en
need to
condiciones
be
que también son
uh,
vulneratorias de sus
applied.
derechos
And
y que
these
muchas
measures
veces
may
duran
require
más de lo que
confinement, and these
duraría
measures
una
sometimes
condena.
take
Este es un
longer
tema
than if
poco
they were
discutido
sentenced
que requiere
to do
estudios, que
time.
es un
And this needs to
desafío
be
para los
studied.
abogados, un desafío para el
The
sistema
challenge
forense
by
y para el
lawyers
sistema
is a
judicial.
challenge for the judicial system and for the penal law or
También
criminal law in general.
la convención y por lo
In addition,
tanto
the
la
convention and
legislación
therefore the legislation
de salud mental
for mental
basada en los
health
derechos humanos,
based
con
on human
respeto
rights,
de los estándares de derechos
respecting
humanos,
the standards
eh,
of human rights, as I have
obliga
explained,
a garantizar
mandate
el consentimiento informado
guarantee of
y a
informed
la
consent
eliminación de las
and
prácticas coercitivas.
elimination of
Esta
coercive
garantía, este
measures.
estándar del
This
consentimiento
guarantee, the
informado,
standard of
está
informed
muy
consent,
ligado
is
a
linked
el derecho
directly
a la plena
to the
capacidad jurídica,
right
es
of the
decir, que una
full
persona que no
legal
tiene plena capacidad
capacity. So a
jurídica o
person with
aquellos
no
regímenes
full
como sucede en
legal
Chile,
capacity,
que
or in
no
situations such as in Chile, where we have
derogado
not
el
been
sistema de
able to eliminate the
interdicción y
system
el
of
sistema de
interdiction
tutela
and the
y
system
curativa
of
consiguiente, se
uh,
hace
legal
difícil la
protections.
implantación del
It is
consentimiento
difficult
informado. Por lo tanto,
to
son
have
dos
legal consent
disposiciones
be
que
a
están
fact, a reality. So these
estrechamente
two
vinculadas.
points are
Eh,
very closely linked
También es
in the
necesario
law,
que
and it is
las
also
legislaciones contemplen y
necessary for the
promuevan
legislations
la
to
planificación
envisage and
anticipada
promote
o lo que se
the
llama las
um,
directrices anticipadas,
advanced
es decir,
directives.
cuál es la
In other
voluntad
words,
de la
what is
persona
the will of the person
en caso de una
in
crisis, en
case
caso
there
de
is a
que
crisis,
no
or in
estén en
case
condiciones
that they
de
are
tomar
under
sus
no condition
decisiones
to make
en
their own
salud.
decisions regarding their health care.
Eso además
This, in addition,
previene y facilita la atención
prevents
en caso de
or
crisis
it facilitates
eh,
healthcare in case there is a
y
crisis, a
también
health crisis, and
evita
it also
eh,
precludes,
estas vulneraciones que se producen respecto
prevents the
de
violation of the person's rights
las disposiciones que
of
posibilitan
the
que
law,
otros tomen las decisiones, ya sea
which
el
then lead
personal de
to other
salud
people
o
making
los
decisions for
familiares
the
o
other person,
personas
either
cercanas.
healthcare personnel
Prohibición de
or
hospitalización y
family members
tratamientos
or
involuntarios.
persons
Y
close
aquí
to
tenemos un caso
the patient.
paradigmático que
We
es
have
la
a paradigm
legislación de
case here
México
with
del
the
año
Mexico legislation, which was
2022
passed in
que
the year
acaba de
2022,
prohibir la
which just
hospitalización
banned
involuntaria.
involuntary hospitalization.
La mayoría de nuestras
Most of
legislaciones
our legislations,
que han sido
which have
modificadas
been
y
changed
adecuadas a los estándares de la convención no han
and
superado
adapted
aún
to the standards of the
la
convention,
hospitalización
have
involuntaria y
not
se
been
han
able to take
centrado
care of
a
involuntary
establecer
hospitalization,
algunas
and
restricciones
they have
de la
just included
hospitalización
some
como un
restrictions
recurso
of
meramente
hospitalization as
terapéutico,
a
un
therapeutic
recurso de
recourse
última
or
ratio, de última
a
instancia,
last
y
instance
sin
recourse.
embargo ya
However,
hay un ejemplo
there
concreto
is a
que es la
concrete example
legislación
already that we're
mexicana
seeing in
del
the
año
Mexican
2002.
legislation, as I
También la
said,
proscripción del
at
aislamiento
the
de
year
funciones físicas o químicas
2002.
están
Also,
prohibidas por
chemical
la
restrictions,
convención y por lo
which are
tanto hoy
uh,
día
forbidden by the convention,
son vulneratorias
and
a los derechos
these
humanos.
also are abusive of
La
human rights,
experimentación
or they
médica
violate
sin
human rights.
consentimiento en Chile
Medical experimentation
todavía
without consent in
hay
Chile,
algunas
well, we
excepciones
still
en la
have
materia.
some
Tenemos la
exceptions
ley
there in this issue.
argentina
We have the
que
Argentine
prohíbe
law, which
la
forbids
proscribe la experimentación médica
medical experimentation
eh,
without consent.
sin consentimiento. Y acá conocemos los
And
abusos
here
que se
we
producen
know
en
that there
esta
are
materia.
abuses committed in this matter.
Leonor, disculpa
Leonor,
que te
I
corto, solo que vamos muy mal
apologize.
de tiempo, así que te pido
We
que
are
intentes, por favor,
lagging
agilizar un
behind. So if you
poquito, a
could
pesar de que es muy
please,
interesante
I
esto más
know you what
adelante.
you're
Bueno,
talking
el
about. It's
acceso,
extremely interesting, but if you could
el
please start
acceso
wrapping
a
it up.
servicios de calidad
Access to quality
la calidad
services.
es parte
Quality
sustantiva, es
is
parte esencial
an
del
essential
contenido,
part
del
of
núcleo del
the
derecho a la salud.
core
Por lo
of
tanto, la
your
disponibilidad,
right
accesibilidad,
to health
aceptabilidad
and
y
health
calidad
care. So
de los
the
servicios de salud mental
quality,
tienen que estar
accessibility,
considerados
affordability,
en la
and availability
legislación.
of mental health care
Igualmente, estos
services need to
servicios,
be included
estas
in the
prestaciones tienen
legislation
que ser
or
sensibles al
health
género,
care
a la
services
diversidad
care.
cultural y a la
And
edad.
they need to be also adapted or mindful of cultural aspects as
Los
well.
servicios prestados en
Services
la
provided
implementación de servicios de la comunidad también
in
está
the
garantizado
community is
en
also
la
guaranteed
convención y
in the
por lo
convention,
tanto
and therefore
estamos viendo cómo
we are seeing
las nuevas legislaciones en
how
materia
the new
de
laws that are
salud
being
mental
passed in terms of
están
mental health
cumpliendo con este
are
mandato y
fulfilling
establecen
this
además
mandate, and
una
they, in addition,
desinstitucionalización
include
gradual
a
y
gradual
progresiva.
desinstitutionalization, which also
La
should be progressive.
participación de las personas con
Participation of
discapacidad
people with
está
disabilities.
establecido como
This
principio,
has
como un
been
derecho
established as
autónomo
a principle,
en
as an
la
autonomous right
vigilancia y monitoreo
in
de
the
la
surveillance and
convención y
monitoring
también
portion
tiene que
of the
estar
convention,
en las
and
legislaciones
it
internas. Y
should
estamos
be
viendo en estas
included in
legislaciones
internal
recientes
legislations. And we're seeing
buenas
that in the
experiencias y
legislations that are
buenas
being
prácticas
made in the different countries,
dirigidos
good
a
practices
establecer
that
sistemas de
are aimed at
vigilancia,
establishing
de
surveillance
monitoreo
systems as well as monitoring
y
systems.
que
And
incluso han impulsado el recurrir a
this
los
has
tribunales
led
para hacer
to
cumplir los derechos
going to the
establecidos en la
judge,
ley,
to
especialmente en
the
materia de
courts,
desinstitucionalización.
especially to make sure that
Yo
disinstitutionalization
ya lo
truly
adelantaba, la
happens. As
importancia
I said before, it is
del
important
monitoreo, de la
to
rendición de
include
cuentas y de la
monitoring as well
vigilancia,
as accountability, surveillance.
las normas de discapacidad normalmente por esta
Disability standards
histórico retraso que traen en materia
historically
de
were
financiamiento, este déficit
backward.
financiero, estas
There was
brechas de
also
cobertura
a lack
que
of
se han
budget allocated
visibilizado por
to mental
OMS,
health. And
OPS,
thanks to the work of
hacen
WHO and PAHO, they
necesarias
have become more visible
atender
now,
estos puntos de
and
detección,
therefore
monitoreo y vigilancia.
there is the
Y
need to
además, por otra
incorporate
parte,
surveillance
el
monitoring and
acceso a
accountability
la
into the
justicia
laws, as well
de las
as
personas
access
con
to their being
trastornos mentales,
justice
de tal manera
administered
que
for
puedan
people with
efectivamente
mental
hacer cumplir
health
los derechos
disorders,
que les
so
están
that their
garantizados tanto en los
rights that are
instrumentos internacionales de
guaranteed
derechos humanos
both in the
como en
international instruments
la
as
legislación
well
nacional.
as in the national
Hay casos
legislations,
muy interesantes
their rights should
en
be respected. There are very
Argentina
interesting
para hacer
cases, for
cumplir
example, in
la ley
Argentina,
que han entablado
to
acciones judiciales
for
en,
law enforcement,
ante los
there have
tribunales
been
nacionales y
lawsuits
han llevado,
taken
han
to
solicitado
national
audiencia
courts
al sistema
where
interamericano
they
de
have
protección de derechos humanos
requested
y un ejemplo que también
hearings in the
se está
inter-American
dando en México, donde se
courts.
está
And there is also an
viendo la
example from Mexico where
desinstitucionalización de mujeres
the
que permanecen
disinstitutionalization
internadas
of women
involuntariamente.
who are
Y con eso termino.
institutionalized against their
Disculpen
will.
si me,
So there are cases
si me
right
he
now in
pasado el
Mexico about this. And I apologize for running over my time.
Muchísimas gracias,
Thank you very
Leonor.
much,
Yo creo que con
Leonor.
tu gran
I think with your
experiencia en
great
Chile, pero también en
experience in
países de
Chile,
América
but
Latina y
also in
con esas
general in Latin American
iniciativas
countries, and
globales, como nos
with
has
all the
comentado,
global
nos has
initiatives that
brindado
you
un
have discussed, you
panorama
have given
general,
us
¿verdad?,
a
sobre cómo
general
es
overview of
clave trabajar
how
en
it
legislación,
is
en salud
key
mental y
to
cómo
work in
podemos
mental health
avanzar en ese
legislation
sentido de
and
los
how we
derechos
can
fundamentales.
make
Con
progress
esos
regarding
elementos como
respect of
datos
fundamental
puntuales y
rights.
tan claves que nos
And you have
arrojabas, ¿verdad? A pesar de
really
que nunca
mentioned
tenemos
these
tiempo para
very
abordarlo de
important
manera,
key issues. We
de
never really
manera
seem
más
to have
extensa.
time
Como
to go
vamos con
over
el
these
tiempo un
things more in
poquito
depth. Since we are
retrasados,
we are
vamos a
running a
cambiar un
little
poquito la
behind.
dinámica en
We are
cuanto a las
going
preguntas,
to
que las vamos a intentar dejar
switch
para el
now, and
final, a
we're
ver
going
si
to
pudiéramos hacer
leave
alguna
questions for the
pregunta para
end
cada uno
and
y
see if we have time to ask questions
ceñirnos un
for the
poquito al
different
tiempo. Así que muchas
presentations. And
gracias.
let's try to
Now,
keep to
please
the
let
time
me
allotted.
switch to English to introduce Dr. Joy Su from Barbados. She's a consultant psychiatrist, community-based, employed by the Psychiatric Hospital in Barbados and serving as the Deputy Chair for the Mental Health Commission of the Ministry of Health and Wellness, which has been involved in the efforts to update the mental health legislation in Barbados. So please, Dr. Joy, you have the floor.
Good day, everyone. Hopefully my presentation will be a snapshot of what we have been doing in Barbados. Let me share. Okay, so you've already done my introduction. I will be presenting on the Barbados experience. So to give you an idea of the context of Barbados, we are a small country in the Caribbean. We have one psychiatric hospital, which is a 500-bed facility, and this has both acute and chronic care services. We provide a number of specialist services, such as forensic services, child and adolescent mental health services, services for those with intellectual disability, among others. Psychogeriatric services are also offered, for instance. There's an outpatient clinic, and we also have persons who are a lot of those 500 beds are actually residential beds for persons who are unfortunately there as chronic patients who are basically living there. And I will get into that a bit later. Then we have the Queen Elizabeth Hospital, which is a 12-bed acute care unit at our general hospital. There's a 12-bed acute care unit at the Queen Elizabeth Hospital, which is called WARC4. And this has 2 outpatient clinics per week, and mainly they do consultation liaison services for the rest of the hospital. So if there's a person on the surgery ward, for instance, who may have a mental health concern, then they will go over and they would see that person. Then we have polyclinics. We have 9 polyclinics, and we have 2 satellite clinics. And at the 9 polyclinics, there are weekly mental health clinics. So at least once a week, some clinics it's twice a week, we have mental health clinics there. Because the psychiatric hospital not only offers services at the hospital itself, but they have a whole community mental health service branch as well that operates within the polyclinics or the healthcare centers in the different parishes in the island. And then we have a number of persons who offer private mental health services, and we have a number of NGOs that offer mental health services. So that is the context of the country or the landscape of the country in terms of our mental health services. Now, some of the challenges that we face, we've been discussing this one quite a lot lately, is that the post of a mental health coordinator in the Ministry of Health and Wellness is vacant. It has been vacant for a number of years. So we do not have somebody who is in charge of coordinating mental health services throughout the island at the level of the ministry. Right now, the planning department in the ministry has been playing that role and doing a good job of it too. But we do really need our own coordinator for services so that we can streamline what happens in the country in terms of mental health. One of the other problems is that the demand for mental health services since COVID-19 pandemic, I think this is the same the world over, but since the COVID-19 pandemic, the demand for mental health services has increased. And even though there has been an increase in demand, we still have a lot of problems with access. In Barbados, I like to say that we have some top-heavy services. We have about 15 or 16 qualified psychiatrists. But when it comes to other services like the mental health nurses, the psychologists, persons who do rehabilitation, say recreational therapists, the occupational therapists, those are lacking. Those are not enough. There are not enough persons providing those services in the public service, meaning free of cost, and definitely not at the community level. But however, at the community level, we just got 4 new counseling psychologists who started this week. So things are looking up, at least in that aspect. So one of the big problems is what I just discussed, is that mental health care is still centralized in psychiatric hospital, even though we have that 10% of the budget overall for health is spent on mental health, which is what is recommended. A lot of that budget goes to the psychiatric hospital. So that is where most of the funding is going, but yeah, that's where most of the stigma is associated. So persons don't necessarily want to go to the psychiatric hospital, because if you go to the psychiatric hospital and persons know that you're there, you're branded with the stigma. People call you quote unquote mad or crazy, and this may affect your opportunities in the community afterwards, which is similar to what Miss Keno was talking about, Olivia was speaking about. When you leave the hospital, sometimes persons view you in a different way, which should not happen. The community mental health services are not fully integrated into primary care, which is another problem. We are just a service that is part of the psychiatric hospital. We are still employed by the psychiatric hospital, but we're operating in primary care, so we're not fully integrated. One of the moves that occurred recently to kind of jumpstart that integration was that our medications are now being prescribed. We're now getting them dispensed from the polyclinic pharmacies. Before, all of our medications used to come from the psychiatric hospital, even though we weren't working there. So we're trying to make progress in these areas. Now, the last challenge I had here, which is relevant to this discussion, is that Barbados signed on as a country to CRPD, the Convention on Rights of Persons with Disabilities, since the 19th of July 2007, but we are not compliant because our legislation is outdated. And hence we saw it as a priority to try to update our legislation. We had actually tried several times. We had some false starts before, but I think this time we will definitely make it to the finish line. So to talk about the legislation, our Mental Health Act is dated 1985, so you can clearly see that it's outdated. And even though there was some rudimentary community mental health services being offered in Barbados at that time, the Act only addresses hospital-based care. So there's no mention of community care in the Act. In fact, it goes right from the definition section straight into hospital admission and hospital-based care. So that is something that's glaring in the Act. It doesn't really embrace a human rights-based approach. It's not that we don't embrace necessarily a human rights-based approach in Barbados to some extent, but I think back then it wasn't even thought of that these things should be detailed in an Act. So there's no details on human rights being protected outside of, in the context of a person who's hospitalized, being protected from being abused while in hospital. And there's mention of penalties for that. But outside of that, in terms of human rights that persons with a mental health problem should have in the general community, there's no real mention of that. But yet there's an entire section on how property and the affairs of the person with a mental illness should be managed. And this talks a bit about what is called receivership, which I know is now something that persons are moving away from as well, because as a type of substituted decision making, you want to stay away from those type of things. And then it talks about something which is a pet peeve for most psychiatrists who work in the public service, medically recommended status. And the last speaker talked about involuntary admission. This is a type of involuntary admission, but a huge problem that it has caused for us is that it lasts 12 months. And for us, that is too long a period for any type of involuntary admission. What has happened in the past is that persons would be admitted in this manner. What happens, the persons, when they're admitted, a relative, someone has to sign the part 1 of this form for admission, and then the relative is supposed to sign them out once they're well. But a lot of times, persons will not come back to sign persons out or sign for persons to leave the hospital once they're well. And sometimes persons used to end up staying in the hospital for long periods, for the entire year before they left sometimes. Once the persons were in hospital, people were reluctant to have them back in the home. Like, I will talk about that a little bit later, because one of the problems of the legislation also is, even though we had something called the Mental Health Review Board, which was an appeal board, if you wanted to appeal your the admission, for instance, or say that you were wrongfully admitted, for instance, there was this board, but the board never really functioned. And so because of that, clients really had no redress for their concerns, which I think was something that was very glaring. So what process did we go through to get to the point that we're at now? We started in March 2023 within the context of the Mental Health Commission, because the Mental Health Commission, where I serve as deputy chair, has 2 subcommittees, and one subcommittee dealt completely with the mental health legislation and updating that legislation. We started by comparing the acts of other countries to Barbados' act, which we thought was a good place to start to see what up-to-date legislation in other countries looks like, to get an idea of what we would want included in our legislation. Then in August of 2023, PAHO engaged a consultant who is an expert in mental health law and policy to assist us with this process. In September 2023, the consultant was here on island to meet with various stakeholder groups. And I will go into that a bit more later, because it's important to, I think, get an idea, not just from us psychiatrists or mental health professionals, what we want to see in an act, but persons who are going to be affected even more personally by this need to have their input as well. So we got input from various stakeholder groups to get an idea of what this new law should look like, what it should include, what are the ingredients that should go into it. In November 2023, from November 2023 to February 2024, we started formulating the draft legislative notes, which is the instructions for the new mental health act. We met every 2 weeks on the morning, 8 o'clock in the morning, and we discussed different sections and what we wanted in those sections and what we wanted to take out of what was presented to us. And in that way, we were able to formulate and complete a draft legislative notes. And then we came back together again in April 2024 for our stakeholders consultation to present the notes. So we had all the stakeholders who were part of the process at the beginning come back, along with some more stakeholders who weren't necessarily there at the very beginning because they weren't available or whatever reasons. And we had 2 days of stakeholder meetings to discuss the notes, let everybody comment on them. They were sent the notes beforehand so they could send their comments by email. They were also allowed to comment during the stakeholder meetings. They were allowed to send comments after the stakeholder meetings so that we could all come to a consensus and see what we could use from those comments. If we had missed anything, what changes needed to occur. And from April to May 2024, we had a discussion of all those comments and we made the necessary changes to the draft note. So that was the process that we took. And that is the point that we're at now, where the draft notes are now, they're being amended, and the next step would be for them to be approved and then go on to the formation of a bill, send them to the drafters. So I mentioned the stakeholders, and I thought it was important to mention that within our stakeholders, we made sure that we had experts with lived experience, which included family members and caregivers, as well as, most importantly, persons who are living with a mental health problem or mental illness. So we had a variety of persons who came in and they gave their views on this. And there were actually persons who I know through my practice who wanted to be a part of the process. And what I will say about this is it was kind of an opening situation for me, because we talk about persons having their human rights and persons should know what their rights are. We have a responsibility to ensure that persons know their rights. And it was only at that point that I found myself in a situation where most of the persons I invited had no idea, whether they were relatives or caregivers or they were service users. They didn't have an idea of what the Mental Health Act actually said. Some of them have never seen it, and I had to provide them with a copy. And I thought that that was glaring, because this is something that would affect their lives on a more personal level, but they didn't know what it contained. They didn't know what it contained. So I think that definitely that was something that we would have to address for future, and it has been addressed in the draft notes, the responsibility to let persons, make persons aware of what their rights are. So then we had a number of NGOs and civil society organizations that support mental health. We had youth mental health advocacy groups. The logo there is for one of them called Let's Unpack It, who's very active as a youth mental health advocacy group. Then we had clergy and religious leaders. This is a very religious country. Anglican religion is one of the biggest religions here, so we made sure to include those persons. We had members from professional associations, whether it was nurses associations, associations for the doctors, psychologists, and social workers. We had all the senior officers for the Ministry of Health and Wellness, PAHO, and we had members of the core group, which were from the Mental Health Commission meet. We met after all the other stakeholders had met to discuss, how this was all going to be put together. And then we included other ministries as well, those from education, which is very important, social welfare. because for mental health services to really work, we have to have a lot of support from social welfare. Then there's law enforcement and judiciary, and we also included persons from the Law Reform Commission who probably will be involved in the drafting process. So what were the aims of this new act? Well, I call these, they're not called the guiding principles in the end. They're under the section of purpose. In the draft notes, I mean, they're under the section of purpose, but I call them my guiding principles for this development of this new act. So we want to adhere to these principles of fairness, equity, equality, and justice. And I think these things really guided how these draft notes were set out. So we want to empower service users. As I mentioned earlier, we want them to be able to recognize their rights. And we want to ensure that they're informed of their rights. So we want to promote treatment with the least possible restrictions. So I work in a community setting. We want to promote treatment that is close to where the client is located. Either we're treating them in their home, which sometimes I will do, because home visits are part of the service I provide. You're treating them at the level of the polyclinic, which is close in their community. So you want to do those things before you think of admitting a person to a psychiatric hospital. And even then, when they're in a psychiatric hospital, there are nuances. You don't want to say, as persons, they use things like chemical restraint and so on when it is not needed. So we looked at all of that in these draft notes. We looked at how to provide oversight and safeguards. There's no point to listing out a whole set of rights if you don't have any oversight or safeguards under it. There's nothing to enforce those rights, which is the situation that we had before. So we didn't want to do that. We want to make sure that these rights were something that could be enforced, that there were penalties for certain things. Because now, when persons, as I said, encounter situations of discrimination in the community, say like when it comes to applying for a job, and someone says, well, they're not going to decide not to employ them because they have a mental health problem, or they develop a mental health problem and the person fires them. There's not really much redress that persons have, unless some persons have been able to fight that, because we do have labor laws and so on. But the problem is sometimes it is more persons who have means who are more able to do that. So now we've given an alternative for having to go that route, and that persons can appeal to the board, which we're discussing, which was the tribunal, if their rights have been infringed in some way. So we want to provide a framework for regulation of the quality and safety of mental health services. So there should be a standard that mental health facilities should have to adhere to, as well as mental health professionals to be registered to give care. We want to make sure that clients are providing the best quality, are provided with the best quality care. We want to ensure efficient access to appropriate care, and to promote integration of physical and mental health care. Because as I said, even though I'm in a community practice, we're not really integrated with the physical practice so much. Of course, we communicate, but there's not true integration happening, and we would like to see that happen. One of the things that we discussed, which will be on the next page under rights, was parity of physical and mental health care. And one of the things that struck us is that we did not even realize ourselves. We have two separate ambulance services. So we have ambulance, the psychiatric hospital has its own ambulance service, and the Queen Elizabeth Hospital, the general hospital, has an ambulance service. And generally speaking, our clients would not access the Queen Elizabeth Hospital ambulance service unless, of course, they've gone of their own accord to the Queen Elizabeth Hospital and they're transferred to our service. But to access that ambulance service for mental health reasons from their home, to transport them for mental health care, I don't think that has been happening. So we realized that we have to train the current ambulance service personnel and make it so that that one ambulance service operates for the entire country, whether or not it is mental or physical health care. So,
Dr. Sue, just sorry to interrupt you. We need to be finalizing, please.
I think there's only one more slide, so that's okay. All right, so we want to recognize that persons have the right to give or withhold consent. So if they can say what type of treatment they want, or if they don't want treatment, that's also their right. And they have the right to decide if they're hospitalized, for instance, who they want to communicate with. I'll skip on to the next slide then. So as I said, we were trying to move away from substituted decision-making to supportive decision-making, and we gave options for clients. So we introduced the concepts of advanced directives, where the person can lay out their wishes for their mental health treatment in the case that they lose capacity and are unable to make decisions themselves. At least they can appoint beforehand a nominated representative, someone who they think will represent what their wishes are, look at their views and their wishes for their care, and uphold this, and will interface with the medical team to make sure that their wishes are adhered to. So they can appoint a nominated representative. Right now, what we have is the next of kin is the person who would be allowed, the next of kin would be allowed to make decisions. And sometimes the next of kin is not a person that the client would have trusted or that the client gets along with. Maybe it's somebody that the client hadn't talked to in a whole long time. So now we give them the option that they can choose anybody of their choosing, whether it's a friend or a family member, to make those decisions on their behalf. We also introduce the enduring power of attorney, so persons can choose not power of attorneys to be in charge of things other than healthcare decisions. So for property decisions or legal decisions, you can choose a power of attorney to make those decisions for you in the event that you lose capacity, and use it as if you lose capacity and you may not get hit back because it's a condition where you may not regain capacity, like a type of dementia, for instance. Just to say that I said it's no point to have these rights if you can't enforce them. And so we introduced the Mental Health Commission. We now made it more of a regulatory body. Right now it's an advisory body. And this will be the body that would ensure that the standards for accreditation for facilities and that professionals have the correct qualifications to be practicing in the fields that they're practicing. And the Mental Health Tribunal, which will be a quasi-judicial body where the appeals would, persons would appeal to if, say, they think that they're admitted wrongfully. It can also work the other way. If you person is admitted, they have a nominated representative, but the medical professional, for instance, doesn't think that the nominated representative is acting in this person's best interest, they can also appeal to the tribunal. So you have these built-in procedures or processes now for redress or for safeguards that we didn't have before. And the medically recommended status was replaced by what is called a facilitated admission, which usually has to be triggered by the nominated representative. And in the first instance, this now only lasts 30 days. You can apply to the tribunal for extension as needed for a further 3 months. But in the first instance, it's only 30 days. And at any point, the medical professional can decide this person no longer meets criteria for facilitated admission, and they can be discharged within that time period, or their status changed to voluntary if they now have mental capacity. So since I'm out of time, I think I will end there. Thank you for allowing me the time to present on this important topic.
Thank you very much, Dr. Su. I think that you have been able to share with us these challenging efforts that from Barbados you are all doing with mental health services, and at the same time with the status of the Mental Health Act and how this Mental Health Commission, the Mental Health Tribunal are working to hardly advance on trying to be aligned with human rights standards. So thank you very much for that. Y ahora nos vamos a mover,
And
¿verdad?
now we're going
del
to
Caribe, desde Barbados,
change
nos
from the
movemos
Caribbean,
hacia
Barbados, to Mexico
con el doctor
with
Gerardo
Dr.
Peña,
Gerardo Peña
Ordieres, quien actualmente se
Ordieres, who
desempeña
is
como
currently
director de gestión de
Director
servicios
of
en la Comisión
Service
Nacional de
Management
Salud Mental
in
y
the National
Adicciones.
Commission of
Él
Mental
es
Health and
médico
Addictions.
cirujano por parte
He's
de
a
la Universidad
surgeon
Nacional
from
Autónoma
the
de
National
México.
Autonomous University of
Realizó la
Mexico,
especialidad de psiquiatría en el
specialized in
Instituto
psychiatry
Nacional
in the
de
National
Psiquiatría y
Psychiatric
también la de
Institute
psiquiatría
and
infantil y de la
infant
adolescencia con sede en
psychiatry
el
and
Hospital Psiquiátrico
adolescence in the Infant
Dr.
and
Juan
Adolescent Psychiatric
Navarro.
Hospital, Dr. Juan Navarro.
Ambas especialidades
Both
cuentan con el aval
specialties have the
académico por parte de la
academic
Universidad Nacional
certification
Autónoma
of
de
the National
México.
Autonomous University in
Así que,
Mexico.
por favor,
So,
doctor
Dr. Gerardo
tiene la
Peña,
palabra.
please, you have the floor.
Muchas gracias. Ya vi que fuimos
Thank you very
nombrados
much.
en
I
alguna
see that we were
presentación.
appointed in some
Y
presentations.
digo, no es por ponernos nerviosos ni mucho menos, ¿no? Pero bueno, vamos a tratar
All
de que
right, we're
esto
going to try and have this be a very fluid presentation and try to keep to the time so that we can run over
Esta
I
situación de las
have
perspectivas de
to
las reformas,
present
acciones y
about
reacciones del capítulo
the
de salud mental y
perspective
adicciones en
regarding
México.
reforms
El
and
contenido va a ser
additions
una pequeña introducción,
to the
qué
law in
modificaciones se hicieron
Mexico.
y qué conclusiones o a qué
So I'll give an
conclusiones hemos
introduction,
llegado.
what changes and what conclusion,
Entonces, para poder
uh,
comprender esto y desde dónde
so that
viene,
we
tenemos
can
que partir de qué
understand where
pasó
we're
con la
coming
atención en salud
from. We
mental.
need
Yo sé
to
que no es
know
clase de
what
historia,
happened
entonces lo voy a ir
with
un poco rápido,
mental
pero sí
health.
es
This is not
importante
a
que
history
nosotros
lesson,
comprendamos
but let
que
us understand, for
el primer
starters,
hospital
that the
de atención
first
en salud mental en México
mental
fue
health
el Hospital
hospital
San
in
Hipólito en
Mexico was Saint
1567
San
y en
Hipólito Hospital in
1687 el Hospital
1567.
del Divino
In
Salvador, en el cual
1687, we
se
had the
internaban
Divine Savior
únicamente
Hospital,
mujeres.
which was for
Posteriormente, durante el
women
tiempo del
only.
Porfiriato,
Later,
se generó y se creó el manicomio de la
the
Castañeda. Esto
the
es
Manicomio
importante
de la
porque durante estos
Castañeda,
periodos seguía el auge
or
de la expulsión
mental
de los pacientes
hospital
con
of
patologías de salud
Castañeda,
mental. Se
was
encerraban, no se sabía más
established.
de ellos y
People were fully
todo
institutionalized. We never
terminaba de
heard
esta
from
manera.
from them
Posteriormente,
anymore,
en
and that was it.
1974,
But then
empezó el
in
Plan Operación Castañeda.
1964, we
¿En qué
had the
consistió este plan? Este plan
Castañeda
consistió
Operation
precisamente
Plan,
en hacer que
which
las
was
personas que estaban ingresadas
aimed
dentro del
at
manicomio de la
having
Castañeda
people
se
who
pudieran
entered
ampliar y se
the
pudieran atender en otros
Castañeda
sitios, así empezando
mental
a
hospital
diseminar o
to
empezando a
be
aumentar la cantidad de
sent or
sitios que atendían
referred
la parte de
to
salud
other
mental.
places,
No
which
obstante,
meant that
todavía
other
estamos muy
hospitals
en
had to
pañales en
develop
este país,
a
como se
mental
dice, que quiere decir
ward,
nos faltaba
but it
mucho.
was just all
Por
very
esto, y a
incipient
partir del
first
2020, del
steps. But
2022, el
in
16 de mayo,
starting
se
in
hizo esta reforma que ya
2022,
fue mencionada.
law
Y
reform,
justo
which is
esta
already
reforma
mentioned
sigue
here,
esta
was carried
pirámide o
out,
ha estado
and
tratando de seguir
we
esta
are
pirámide, en
following
el
or trying
cual
to
la
follow
base de
this
la pirámide
pyramid,
es
where
el
the base of the
comunitario y
pyramid is
luego
the
y
community
el
level
autocuidado. Posteriormente
self-care.
está
No,
el
first
cuidado
it comes
comunitario
self-care
informal,
at the base of the
servicios de salud
pyramid,
mental
then
primaria en la
informal
comunidad,
health
servicios de
care,
salud
then
mental
community
comunitaria, servicios
health
psiquiátricos de hospital
services,
general y
and
al
then
final
general
servicios
hospital
hospitalarios o
wards,
servicios
and then
psiquiátricos
at the
hospitalarios.
end,
¿Y
the
por qué
tip
lo
of the
empezamos a
pyramid,
ver de esta
mental
manera?
health hospitals.
Porque
And
es
then
importante esto.
eh,
La
why
idea
is this
es, tenemos que
important? The
favorecer
idea
la
is that we
función rectora
needed
e integración
to
operativa de la función de la salud
integrate the
mental y las
operation
adicciones.
of
Tenemos que
mental health and
garantizar la atención de la
addictions.
salud
We
mental
need to
o de salud
guarantee
integral y
in,
continua de los
integral,
distintos tipos de enfermedades y
comprehensive, and continuous
comorbilidades.
mental
Tenemos que
health
alinear la
care
Ley General de
as
Salud
part
con los
of the
estándares
whole
internacionales en
health
materia de
care,
derechos
and we need
humanos,
to
salud
align
mental y
ourselves to
discapacidad.
international standards
Justo
regarding
a lo que
human
se estaba
rights
hablando
and
mucho es tenemos
mental
que
health
transitar
and
hacia el
disability
modelo de
rights.
atención comunitaria,
So
con
we are
enfoque
also
principal
going to the community
con enfoque
care-based
principal
model
en atención primaria
focused
de la salud
on primary
y
health
redes de
care
servicio
and
integradas. Tenemos que privilegiar la
comprehensive
capacidad
integrated
jurídica de personas
service
y eliminar
networks.
el estigma
We
histórico.
needed to
Y si nos damos
respect
cuenta,
the
estoy
legal
hablando justo de lo mismo
capacity
que se ha
of
estado hablando en las
persons and
diferentes
eliminate
presentaciones.
the
Solo que
historical
aquí
stigma associated with
viendo esto
mental
ya como una
illness.
realidad un poco
And this
más
has been
actual.
mentioned already by other
Aprovechar los
presenters.
escasos
So we
recursos
need
que
to
se tienen en
live
salud mental
in
y
the
adicciones
present. We need
y
to
sustentar
take
la
advantage
actualización de
of
la
the
norma
scarce
025
resources
o la norma
for mental
mexicana
health
que se
and
encarga de la gestión
addictions. And
psiquiátrica en
then we
hospitales
have
y
to
junto al enfoque
have
comunitario se
a
tiene
community
meterlo al Sistema
approach
Nacional de
and
Salud. Esto
integrate
no ha
all
sido
of this
fácil
in the
y tuvimos que
national
hacer algunas
health
modificaciones
system.
y
This
esto se
wasn't
dio
easy.
en
We
una
had to make
ley,
some
en una
changes,
gestión que no se había modificado en
which
un poco más de
uh,
40 años.
this
Entonces,
was a
es
law
algo
that
que a
had
nosotros nos da
not been
mucho gusto
touched in
poderles
over 40
compartir.
years.
Lo
So
primero
it
que
is a
tuvimos que
pleasure to
hacer
share
es
this with you. The
justamente
first thing we
reforzar la
needed
parte
to
de
do was to
consentimiento informado. Ya
reinforce
se mencionaba
the
que por parte
portion
de
of
México
informed
el
consent
ingreso involuntario
in
al
Mexico.
manicomio se
Involuntary
logró eliminar. Y justo es eso, el
hospitalization
consentimiento
was
informado es la
done away
manifestación
with.
tácita o escrita del derecho a
Informed
la
consent
capacidad jurídica.
then respects
Precisamente es
the
esto. Todos
legal
los
capacity.
ciudadanos, todas las personas
All
tenemos derechos humanos.
persons
Los
have
prestadores de
human rights.
servicios de salud en general,
Service
los prestadores de
providers, health
salud,
service
están obligados a
provided in
comunicar
general
los
are
objetivos, posibles beneficios y
mandated
riesgos
to
esperados y las alternativas de
inform on
tratamiento,
all
todo esto sobre el abordaje que se tiene
treatment
que dar. Y lo
alternatives,
importante
risks,
en las
and
situaciones
all
en las que
other
la persona
pertinent
no pueda dar
information.
su consentimiento,
If a
no
person
existe un
cannot
documento de
provide
voluntad
their consent,
justificada
if
y
there
su vida
is
estaría
no
expuesta a un riesgo inminente o su integridad física, a un daño
advance
irreversible, el
directives, and if the
prestador de salud
person
procederá inmediato para
would
preservar la vida
be
y
in
salud
risk, the
dejando
person in
constancia
charge of healthcare needs to make a decision, but report to competent authorities. There needs to be a demonstrable risk to health
Ahora,
for
con la
this
finalidad
to
de
happen.
fortalecer esto un
In
poco
order to
más,
strengthen this
entonces
even
también se
more,
reformó el artículo
the
72. ¿Qué quiere decir esto?
Article
Que se establece
72
aquí la
was
prevención de las
reformed.
adicciones tendrán un
So
carácter
mental health and
prioritario
addiction
dentro de las
prevention will
políticas de
have
salud
priority within
y
health
deberá de brindarse
policies,
conforme a lo establecido
and
en la
it should be
Constitución
offered
y en los
according to
tratados
what is
internacionales en
established in the
materia de
Constitution
derechos
and
humanos.
international
¿Qué quiere decir
treaties
esto? Estamos basándonos
related to
mucho en
human
la
rights. So
actuación
we are really
justo
basing
con la parte
ourselves
internacional y basado en
on
la persona,
not
los
only
convencionados.
our
Entonces, el
constitution, but
Estado
also
garantizará el acceso
international treaties.
universal,
So the state will
universal,
guarantee
igualitario
universal
y
access, which is
equitativo. ¿Esto qué quiere decir?
egalitarian
Todo
and
tiene que estar
equitable.
basado en un
This all
enfoque
should be
de derechos
based
humanos.
on the
Para
human
esto,
rights
entonces,
approach. And for
tenemos que
this,
entender que el
therefore, we
propósito
need to
último de los
understand that the
servicios de la
ultimate
salud
purpose
mental
of
es
mental
la
health services
recuperación y el
is
bienestar.
recovery and
¿Y qué quiere
well-being
decir
of the
esto? A nosotros
person.
estamos
What does this
atendiendo
mean?
esta parte de bienestar con
We
el
are taking
despliegue
care
óptimo
of
de sus
the well-being
potencialidades individuales
part
para
by helping
convivencia,
people
trabajo y
develop their
recreación.
potentiality
Nuevamente,
in
estamos haciendo un enfoque
work,
basado
in
en la persona, no basado en
livelihood,
números, no basado en texto.
family.
La
So we are
recuperación va a
basing
cambiar de
ourselves
persona a
on the
persona y
person,
esto también tiene que ver mucho
and
con preferencias
not
individuales para
other
poder tener
matters.
una vida
And
autónoma.
we
La
need to make
atención a la
sure that
salud
people have
mental nuevamente
autonomous
tiene un
life.
enfoque
Uh,
comunitario que está basado en
Mental
la
health
recuperación
care
y está
is
estricto
based on the
respeto a
community,
los
based
derechos
on recovery,
humanos.
and it
Esto quiere
is
decir que
uh,
tiene que haber un
uh,
apego a los principios
strictly
de
adhering to
interculturalidad,
human rights, and
interdisciplinariedad,
there should
integralidad,
be
intersectorialidad,
interculturality,
perspectiva de género y
interdisciplinarity, integrality,
participación social. Esto es lo que nos
intersectorality,
está ayudando mucho
gender
a llevar
perspective,
esto pues
and
adelante.
this is
Ahora,
helping
también
us,
tenemos que
or
ver
this is
esto.
guiding,
El
these are
hecho
the
de que
guiding
previamente no se
principles.
haya modificado la Ley General de Salud
The
Mental,
law hadn't
Salud
been
Mental y Adicciones nos
reformed,
dejaron un poco rezagados en
and
comparación a otras
therefore
partes,
we
pero la
were
modificación y el artículo
lagging
73
behind
ter
vis-a-vis
menciona que la
other
atención de salud mental en
legislations.
las
But
adicciones
Article
del
33 says
comportamiento
that
comprende todas las acciones a las que se refiere el
all
artículo 73 de la Ley
actions
General de Salud.
included in
Y a uno le
this law
parecería, pues es que
33
tiene que ser. ¿Cuáles son?
includes
Preventivas, curativas, de
preventive,
rehabilitación y
curative,
paliativas.
rehabilitative, and
Curiosamente tuvimos que
palliative
agregar esto
medical care
porque esto
activities.
era
We
algo
had
que
to
pues no
add
se
this to the
consideraba.
law because this was not
Dentro del
considered
artículo
in the
73
past.
se
In
adicionó y se
Article
reformó algo.
73,
¿Qué quiere
we
decir?
also
Deberá
reformed some
privilegiarse la
things
atención
where
comunitaria. Esto en
community-based
implementación estratégica de
care
servicios de atención
should
en salud
be
mental y
the
adicciones tiene
priority.
que ser en los servicios de la red
So
integrada de
we need
servicios
to
de salud
start
del
within
Sistema
the
Nacional de Salud.
national
¿Qué quiere
network
decir esto?
of
Que
services
podamos
within the
abatir la brecha de
National
atención.
Health
Y esto también
Service
se tomó en
system.
consideración mencionando
And
que
we
en México
need
más o
to
menos solo
uh,
tenemos 5,000 psiquiatras en
bridge
todo el
the
país
gap. We
de la
only have
República.
5,000
Entonces
psychiatrists
empezamos a
in the
tener que
whole country.
transferir competencias
So
a otros
we
profesionales que
needed
nos
to
ayudaran
start
a
transferring
esto. Y todavía
competencies to
seguimos con el
other
desarrollo
health
infantil y de la
professionals.
adolescencia, pero
And
sin duda
for
alguna en toda la República
adolescent and
somos
child
300 profesionales de
psychiatry,
esta
we
materia.
only have 300
Entonces tenemos que
specialists
empezar a desarrollar también
in that
equipos de
field. So
respuesta
we need to
inmediata para
develop
situaciones de
immediate
crisis.
response
Esto tiene que
teams
estar en
for
capacitación,
crisis
tiene que ser
situation.
personal
And
capacitado en
these
técnicas
ought
para
to
atenuar
be
el escalamiento de crisis. Lo que hicimos nosotros aquí en
trained
México,
staff
precisamente
for
para tratar de
crisis
atender esto,
situations in
fue
Mexico.
involucrar a
Therefore,
otros
we
profesionales de salud que
decided to
no
include
necesariamente estaban
other health professionals
capacitados
who were
inicialmente en
not
atención de salud
necessarily
mental y
initially
adicciones.
trained to
Ahora,
work on
también para
mental
que
health
nosotros
and
pudiéramos tener
addictions.
como un fundamento
So,
más
in order to have a more
incluyente, también estamos
inclusive
fomentando mucho la
approach,
participación de observadores
we
externos en derechos
encourage
humanos. ¿Y
participation
esto
of
para qué? Para nosotros
external
poder tener
observers
implementación de un mecanismo de
who are
supervisión
experts in human
y el desarrollo de
rights,
tanto las
so
leyes, las
that
normas,
we can
y
have
esto con la finalidad de
oversight
que se promueva,
and
se proteja y
respect
se
for laws
garanticen
and
los
standards
derechos
to
humanos.
promote and guarantee
Ahora,
human
las
rights.
instituciones de salud fomentan y
Health
apoyarán, entre otros,
agencies
el
will
desarrollo de acciones y
also
programas
foment
para
and
detectar,
support, among
atender y
other things,
prevenir el suicidio. Estamos
actions
involucrando
and
todo el
programs to
sistema de
detect
salud.
and prevent suicide. And
Para
this
esto, las
involves the
instituciones
whole
del Sistema
uh,
Nacional de Salud
health
deberán
system. And
brindar
so the
acceso a los
agencies
servicios de
of the
atención según
mental
los siguientes
of the
principios. Ejercer
national
desde
health system
domicilio para que
will
no
need
tenga
to
que pues,
provide
estar viajando
supportive
mucho para la atención.
services
Respeto a la
uh,
dignidad.
to
Medidas para
respect
la toma de
dignity,
conciencia, erradicación de
to
estigma y
become
de
aware
estereotipos,
of mental
reducción
health
de
issues,
daños,
to reduce
atención prioritaria
stigma,
siempre que se
and give
encuentren en
priority
situaciones de
care
vulnerabilidad,
whenever people live in
atención primaria a
situations
la
of
salud, como el
vulnerability. Primary primary health care should be the primary focus. And it's interesting, we always talk about mental health outside health, but One Health
Acceso y
is
atención
the
a la
approach.
plataforma interdisciplinaria
So
y
interdisciplinary
participación de
and
familiares y de
comprehensive
las
integral
organizaciones
care and
para
access
combatir
should
los
be a
estereotipos u otras
priority
ideas o
to
imágenes que comúnmente
combat
están
stereotypes
equivocadas,
or other
inclusive
ideas
pues
which are
accesible
frequently
y algo está a nivel
mistaken.
mundial,
And we
se
see
realizará
this
lo siguiente:
worldwide. We
programa de
will do
capacitación
this,
para
train
profesionales. Esto con la finalidad
professionals,
también de
and this
reducir
in
el
order
estigma
to
existente
reduce the
que se ha
stigma
encontrado, que
that
estuvo
has
encontrado
been
dentro del sistema
found
nacional de
to
salud de México,
persist in the
difusión de campañas de
health
comunicación
system
social,
in Mexico.
programas
Also
educativos
having
complementarios con
communication
enfoque de género y
campaigns
con
in the
enfoque de
media, also
derechos humanos y
educational
perspectivas de
programs
género,
that are
y
focused
programas elaborados de
on
comunicación masiva en
gender
lenguaje claro y
issues,
entendible
human
para la
rights
población.
approach
Para esto
for
también
mental
se
health.
modificó y se reformó el
Also,
artículo 74
Article
y esta modificación
74
del artículo
was
74
reformed,
se
and
realizó teniendo en
these
consideración
amendments
esta pirámide en la
were
cual
carried out
nuevamente
considering the pyramid
todo
that I
debe
already explained
inicialmente
to
con
you.
el
So
autocuidado y
initially, things
posteriormente
start at the
fortaleciendo al
base
cuidado
with
sanitario informado
self-care,
por
and then we
servicios de
go
salud
to
mental de atención
community
primaria de salud,
informal
pero
services,
luego
then
servicios de salud mental
primary health
comunitarios y
care
servicios psiquiátricos de hospital
for
general y
mental
servicios
care,
especializados.
also
Esto
community
porque la idea es
services
que se tiene
for
que
mental
apoyar
health,
y garantizar el acceso a la continuidad de la
hospital
atención. Entonces,
healthcare
servicios
in general
se
and
tiene que buscar
specialized
servicios de
services. So
pediatría,
we need to
establecimientos
find
ambulatorios de atención primaria,
ambulatory primary
pero no
health
solo
care
eso,
units.
no podemos
Not
seguir
only this,
relegando
we
la atención
cannot
de la salud
continue to
mental a los
relegate
hospitales
mental
públicos.
health
Entonces,
care
lo que estamos haciendo
to
es fomentar
psychiatric
servicios de salud
hospitals. So we
mental
are
en hospitales
encouraging
centrales y
that
regionales de alta especialidad e institutos
mental
nacionales de
health
salud.
care be
Y aquí viene
provided
esta parte
also in
importante que ha
general hospitals
existido,
and
pues comentamos,
other community
eliminar
health
el
centers,
modelo asilar. ¿Qué quiere decir
eliminating the
esto? A partir
institutionalized
de la
model.
publicación de
So
esta nueva
after
ley, no se van
the
a generar nuevos
publication of the
hospitales
reform
no
of the
especializados
law,
en
we don't have
psiquiatría, y los que
single
existen ya están construyendo y
specialization
convirtiendo en centros
hospitals.
ambulatorios u
So
hospitales
we have
generales,
ambulatory
pero como
units
acordamos
or
en el
general
punto previo,
hospitals that
en los
have a
cuales se
psychiatric
menciona
ward.
paulatinamente que
And
tiene que haber
so
atención de salud
gradually
mental en
there should
todo
be
el sistema de salud. ¿Qué quiere
there
decir
should
esto?
be
No es
mental
algo que
health
vaya a
at
pasar de
all
la noche a la
levels of
mañana.
the
Estamos seguros de esto,
healthcare
pero es
system.
algo que
This
poco a
won't
poco
happen
tiene que ir
overnight,
pasando
but
siguiendo los estándares
following
internacionales.
international standards,
También en el artículo
we
72,
are
la
getting there.
Secretaría de Salud, de acuerdo
Also,
con el enfoque de
Article
derechos humanos,
72,
deberá hacer
according to the
explícitas las
human
intervenciones
rights
prioritarias de
approach,
salud mental
there
y
should
adicciones,
be
y esto para garantizar el acceso a las acciones de
interventions
prevención y
to
atención en la
guarantee that
materia.
there be
Estos apuntan
prevention
también con
in
esta
this
parte.
matter. And this
Población
is
usuaria de los
important
servicios de
because
salud mental tendrán los
the
siguientes
users of
derechos: la
mental
mejor
health
atención posible,
services will
contarán con
have the
mecanismos de
best
apoyo para la toma de
care
decisiones y
available,
directrices de
have
voluntad
mechanisms to support
anticipada,
them in
consentimiento
decision
informado.
making
No pueden ser
and
sometidos a medidas de aislamiento
advanced
o contención coercitiva, la práctica que
directives,
constituye datos
informed
crueles,
consent.
inhumanos o
They
degradantes en
should
su
not
caso,
be
ser sometido a
submitted
medios
or
medicamentales de
subjected
aislamiento
to
y
isolation,
tienen derecho a un diagnóstico integral de salud
coercive
veterinario, tratamiento
contention,
basado en
or any
criterios
other
fito
practice that
individualmente con historial
will
clínico, a no
be
ser sometido a
cruel
tratamientos
or
antidepresivos o
inhumane.
que
They should
modifiquen la
not
integridad de la
be
persona, que la
subjected to
confidencialidad y el laboratorio
irreversible
deben acudir
treatments.
lo más
They
cercano
should
al
have the
domicilio posible,
right
a tener
to
acceso y
privacy,
disponibilidad a
to
servicios
have
de salud mental y
access and
adicciones, y a los
availability
derechos
of
establecidos en la ley de
services in
discriminación de
mental
género.
health and for
El
addictions,
internamiento
according to
hospitalario se
national law.
considera el último recurso terapéutico y tiene que
The
ser
hospitalization is
voluntario,
the
tiene que
last
mostrar
therapeutic
mayores
result,
beneficios
recourse.
terapéuticos al
And they
tratamiento
have to
ambulatorio,
show
tiene que ser
improvements. They
el
have
tiempo
to
estrictamente necesario
follow the
y
strictly
tiene
necessary
que ser,
time,
además de los
and it
hospitales con los que contamos,
must be in
también
the
tiene que ser en
hospitals that we
hospitales
have. It must also
generales
be in
o
general
pediátricos en
hospitals or
caso de niños y
pediatric
niñas
hospitals
menores
with
de
cases
edad,
of
y por
children
ningún motivo el
underage.
internamiento puede ser
And at no
indicado o
time should it be
prolongado si
recommended
tiene
as a
el fin
prolonged
de
period.
resolver problemas
If it has
familiares,
the
laborales,
possibility
de
of
vivienda o sociales.
considering the social
Esto
or
principalmente
housing
tiene que ver
situations.
con cómo se
This has to do
había
with the
manejado
way in
previamente, y
which
esto
this was
beneficia a las
previously managed,
niñas,
and it
niños o
benefits
adolescentes,
children or
se privilegian
adolescents
las alternativas
with
comunitarias,
favoring
se
community
llevan a cabo
alternatives,
estas atenciones en
doing
hospitales
this
generales
in
o
general
pediátricos,
hospitals or
y en caso
pediatric
de no
hospitals usually.
estar de
And
acuerdo
if
con el
they do not
tratamiento,
agree
se
with the
tiene que
treatment,
trabajar
there
conjunto a la
should
persona
be
que está dando la
uh,
atención para
work jointly
tratamientos
with the person
adicionales.
for additional
La
treatments to
persona
be
con
considered. The
trastorno mental que
person
por
with a mental
consume sustancias
disorder
psicoactivas
or due to
ostenta el derecho a
psychoactive substance
consentir o desviar
consumption
el
have the
permiso a
right to
cualquier tratamiento o
accept or
internamiento.
deny any
Y
type of
esto es
treatment
porque
or
tiene
in
discapacidad
hospitalization because they
discernir,
have
tienen
a
que aceptar
right to
nuevamente
discern.
de forma
They
voluntaria un
have to
tratamiento o
voluntarily accept the
internamiento.
treatment or the hospitalization.
Ahora, en previsión de requerir servicios
In
futuros de atención
future
médica, se está
services for
trabajando
medical
en la
care,
realización de
we're
voluntad anticipada
calling
y
what is called
la
anticipated
persona con
will,
la
where
capacidad
the
creativa en
person
ese momento pueda
has the
determinar el tipo
ability
de
to
acciones
determine the type
para
of
el
actions
tratamiento que va a llevar en el
required for the
caso en el cual
treatment in
se
case
encuentre una agudización del
the
cuadro.
the case
Inclusive dentro de esta
becomes more
facultad
acute.
anticipada puede existir la negativa
This
a recibir
may
el
be
tratamiento.
refused. They can refuse to receive
La
the treatment if
Secretaría
they
de Salud
wish. The Health
establecerá las normas
Secretariat will
oficiales
establish the
mexicanas para
official
los
Mexican
establecimientos que
standards
prestan
for
atención a la
those
condición
establishments
usuaria de los servicios de salud
offering
mental y conducta
services of
profesional
mental health
psicoactiva
and
en la red
psychoactive consumption
de Servicios Nacionales
in
de
the
Salud,
National
y esto
Health
también
Service Network.
considera
And
la
it
parte
also
de
considers
atención
the
pública,
public
social
care,
y
social
privada.
care, and private.
Los establecimientos del
These
Sistema Nacional de Salud
facilities
elaborarán programas para la
will
atención de
prepare
los familiares
programs
y
to
círculos
care
social
for the
cercano,
family and
precisamente algo de
social
lo que tú has estado
circle
hablando.
of the
Esto para obtener
patients.
información sobre
And this is
canalizaciones de
to obtain
servicios, psicoterapia breve y
channeling of the
promoción de
services,
apoyos
brief
grupales.
psychotherapies.
Me fui un poco rápido, pero ¿qué
I was a
podemos
little
concluir de
fast,
todo
yes,
esto?
but what we can
Es un
conclude from all
avance
this is that it's
positivo,
positive.
tenemos un rumbo al cual
We
estamos
have the right
apegándonos, ya
road we're
conocemos la ruta
following.
muy bien planteado,
We have it
inclusive en la
very
Secretaría de
clear.
Salud.
The health
Todavía
secretariat
quedan
is
algunas
very clear. There are
modificaciones que
still some
pueden
things that
hacer
we
a
have
la
to
ley,
change
pero en esta
to the
tenemos que
law,
participar todos los
but we
prestadores de
have to
servicio.
have the
Falta
service
modificar
providers
todavía
to
las normas
participate in this.
oficiales
We have to
mexicanas de
change the
aquí
official
de
Mexico
nuestra república,
standards here
pero
in our
siempre
country.
tenemos que
But
considerar
we
a la
always have to
persona
consider the
como el eje
person
de
as the
tratamiento.
center of the
¿Qué
treatment.
retos estamos viendo
And the
actualmente?
challenges that we're
Estamos
seeing
teniendo
now
retos para el
is
seguimiento de la
in
implementación.
following
¿Y
up
esto
the
por qué? Porque
on the
todavía tenemos
implementation,
mucho
because
personal
there are
que entra
still
dentro de la
many
república que
people in
tiene
the
este
country
estigma sobre la
who
salud
have that
mental, que es lo que
stigma
estamos
regarding mental health,
combatiendo.
and this is what we're trying to fight
Tenemos
against.
dificultades
We
actualmente en
have
algunos sectores
current
administrativos y
problems with
operativos
some of the
clave
administrative and
porque en el
operational
tratamiento ni intereses que
agents
están
because it
fuera del
has to do with
tratamiento de
a
la
lot of the
persona
things
y
that
las
have to
partes
do
están
not to
tomando
do with the
como
health
ejemplo.
of the patient, and we're trying to fight
Y
against
también
that
es
as well.
esto, estas
And
estrategias para
these
reducción del
strategies to
estigma, tanto
reduce stigma inter
intersectorial,
and intra sectorial
tenemos que considerar
have
también
to consider
el
the
involucramiento de las
involvement
organizaciones de la sociedad
of the
civil,
civil
líderes
society
comunitarios, tanto
organizations as well as
implícitos y
community
explícitos.
leaders,
No obstante, muchas
explicitly and
veces estas
implicitly, because
organizaciones
many of these organizations
tienden a solo
tend
ver el
to
enfoque desde su punto de
only
vista.
see
Entonces,
their
sí ha
point
habido
of view.
algunas ocasiones en las
So we
cuales
have
hemos
had
tenido
cases in which we've
ligeras complicaciones.
had slight
Y tiene que ver con
complications.
esto, con que
And
pocas veces
it's
se les había
because
escuchado aquí
seldom
a
had
la
we
realización
heard
de este tipo de avance y en
that
esta
this could be
situación,
done
pues quieren
under these
expresar lo más
circumstances,
posible.
and they want to give
Muchas
their
gracias, ese es
opinion.
mi correo para cualquier
And
duda o
that's all. This
pregunta.
is my
Traté de irme
email
un
if you have
poco
any
rápido
questions. I
para
did
no
go a little bit fast
comerme el tiempo.
so as not to take up too
Estamos
much
haciendo
of your
muchas cosas.
time. We are
Sé
doing
que
a
es
lot
un
of
plan
things.
que
I
estamos
know that
tratando de
our
avanzar y que
plan
nos ha tomado mucho
is
tiempo, pero
positive.
les
It's taken
agradezco
us a lot
mucho
of time, but
la
I thank you
invitación
for
y
your
también la
time and for your
participación. Muchas
invitation.
gracias.
Thank you.
Muchísimas gracias,
Thank you
doctor
so
Gerardo
much, Dr.
Peña. Yo
Gerardo
creo que nos
Peña,
ha
and I
brindado
believe
un
that you've given us
resumen
a
sobre esos
pretty good
grandes
summary
avances de
of all
México,
the
tanto a nivel
progress attained in
legislativo
Mexico legislatively
como a
as well
nivel
as
operativo, aunque aún
operationally.
sigue siendo muy,
It's,
muy,
we
muy
realize that
reciente,
it's
¿verdad?
still a very
Toda esta
recent
reforma.
reform.
Y creo que
And
nos
I think
aporta
that
también
you've
algunos grandes
also
desafíos que están
mentioned some of the important
enfrentando
challenges you're facing
y herramientas que son
and
como
some of
muy
the
útiles
tools that
tanto
can be
para los
very
servicios de
useful
salud
for the health services
como
as
para
well as
cuestiones
for
de la vida cotidiana, ¿no? De las
matters
personas
related to the
con
daily
problemas de
life of
salud
persons with
mental.
mental health problems.
Creo que la experiencia de
I
México es
think that
un gran
Mexico's
aporte
experience is an
para el
important
resto de países,
contribution
así
for
que
all the other
muchísimas
countries. So
gracias por
thank you very
compartir.
much for sharing this with us.
Y bueno, ya para
And
ir finalizando,
to
desafortunadamente nos
conclude,
hemos quedado sin
unfortunately,
tiempo
we
para
don't
abordar
have time
algunas
for
preguntas que nos
questions.
habría encantado
We would
tener
have loved to have
ese
had
intercambio,
the
pero bueno,
exchange,
todo
but
es tan interesante
it's all
y
been
tan
so
rico,
interesting
¿verdad?
and,
En
and
los
it's been
aportes
such
que
a
han hecho
wealth of
cada uno de
experiences
ustedes que bueno,
that
nos vamos a ir
we
cerrando
will
aquí, pero antes de
have to
eso,
adjourn now without the
I would
questions.
switch
But
again
before
to
that,
English and
Nick,
finally, I would like to introduce my colleague, Olger Gonzalez. He is the Human Rights Advisor in PAHO, and he will provide some final remarks to the webinar. Please, Olger, the floor is yours.
Muchas gracias, estimada Carmen.
thank you
Es un
very much,
principio de
Carmen.
derecho internacional
This is a principle of
que
international
los
law.
estados están obligados
States
a adaptar
are
su derecho interno a las
forced to adapt their
disposiciones
internal
de los
laws to
tratados
the
internacionales
provisions
en
of
que son parte
international treaties
y
that they're part of,
particularmente en los
and
tratados de
particularly
derechos
the
humanos
human rights
Adaptar
rights
significa
treaties.
en determinados contextos
Under certain circumstances, what this
adoptar
means
nuevas
is
leyes,
to adopt
derogar,
new
modificar,
laws and
reformar,
repeal,
siempre en
amend, or
función de la mejor
reform,
protección
always
de
based on
los seres
the
humanos.
protection of human
Hace
beings.
poquito
Recently,
murió el doctor Isaac Lebab,
Dr.
que
Isaac
fue
Lebab died.
su momento
He,
en los años
at,
90,
at the time, in
jefe
the
de la
90s, was
Subunidad de Salud
head
Mental
of
de la
the mental
Organización
health
Panamericana
unit
de
of
la
the Pan
Salud,
American Health
que fue uno de
Organization,
los grandes
and one of
pioneros
the
de
real pioneers
introducir el tema de los derechos
introducing
humanos
the
y
topic
salud
of human
en la
rights in
organización
health
y
in the
más allá de la
organization
organización.
and beyond.
Cuenta la historia
And story
que él fue
tells
uno de los
us
pioneros de la
that he was one
Declaración
of
de
the
Caracas.
pioneers
Esa
of the
declaración de
Caracas
1990
Declaration, which was in
une a
1990,
practicantes de la
and
salud
it
pública,
groups
particularmente
public
salud
health
mental,
practitioners, public
legisladores y
health
abogados de derechos humanos
legislators,
en
and
1990
attorneys,
y desarrollan
and
una serie de
in
principios
1990, developing a
que,
series of principles
conocidos como la Declaración de
known
Caracas,
as
que
the
ya
Caracas
decía en ese
Declaration, which
entonces
at the
que las
time already
legislaciones
said
deben
that the
ajustarse
laws
para
had to
que
be
aseguren el
adapted
respeto de los
to
derechos
ensure
humanos
respect
y
for human
promuevan
rights
la
and
organización de
promote
servicios
the
comunitarios de salud
organization of
mental que
mental
garanticen el
health community
cumplimiento.
services,
O sea, que
guaranteeing
vemos
these
aquí
rights.
cómo
So
desde entonces y
from
muy
then, we
atrás se
already
viene
see
avanzando
that
hacia una
there was
lógica
a
que
lot
está,
of
por supuesto, reflejada
progress
en las
in this logic,
resoluciones
which is
de
reinforced in many of the
no
resolutions,
solo de la organización,
not
sino de
only
la
of our
OMS, sino
organization, but of
también
the
del Sistema
WHO as well,
Interamericano de
and the
Derechos Humanos.
Inter-American Human Rights
Él
system.
y su equipo, y esto es un
He and his
pequeñísimo
team, and this
homenaje
is
a
just
él
an honor to
también,
him,
aprovecho para hacerlo,
and I take advantage of doing
comienzan la
that,
transformación
begin
de esta
this
legislación
transformation
legislativa
of the
y
legislation,
salir de los
trying to
aislamientos
get
en el que
out of
estaban los
that
hospitales psiquiátricos,
isolation of psychiatric hospitals,
reformando leyes y
reforming the
políticas con
laws and
base en los
policies
tratados de derechos
based on the
humanos.
human rights treaties.
El compromiso histórico de la
The
OP
historical
se
commitment of
refleja, por
PAHO,
supuesto, en diferentes
of
formas. La
course, can
misma
be
resolución de
reflected in different
2010
ways.
de
The
derechos
resolution of
humanos
2010, the
exhorta a
Human
los
Rights
estados a
Resolution,
que apoyen la
urges
cooperación de
states
la
to
organización en
support
la formulación,
the
revisión
organization's cooperation
y
in the formulation, review,
reformulación de
and
legislación sobre
reformulation
salud.
of
El
health
derecho a la salud mental
legislations. The right
incluye
to
la
mental
salud
health
mental y los
includes
derechos
mental
humanos
health and human rights,
relacionados como la integridad personal, que
as the
incluye la
personal
integridad
integrity.
mental y
It
emocional.
includes mental and
Bolivia y
emotional
Paraguay
integrity.
nos
Bolivia,
hablaba
Paraguay
de la ley
spoke of us
7018
of
que
the Law
planteaba la
7018, which
desinstitucionalización
speaks
progresiva.
of the
Nos
progressive
decía
deinstitutionalization,
el estigma grabado en la
talking about
frente de
the
loco o
stigma
loca
that she
y la
had on her
dificultad para
forehead
insertarse en el
recording the
mundo
word
laboral,
crazy, the need to
a pesar
reinsert
de que
into
hay
the labor
normas
market,
que así
despite
lo
the fact that
exponen.
there were
Eh,
laws that
Dice, nos decía
cited this,
Olivia,
provided
si
for
no hay
this.
espacios
Olivia was
comunitarios,
telling us if
dejamos a
there's
la
no
suerte la
community space,
recuperación con
we
peligro de
let
retroceder
them
al internamiento. El
try to
control
survive
planteaba
and
la
end up
importancia
maybe
del
going
medio de
backwards.
comunicación y el lenguaje
And
respetuoso, así
she
como
spoke of
otros
respectful
espacios como la
language and
familia
spoke
y
of
las escuelas.
spaces like family and
Leonor
school
de
to
Chile
accept this.
nos
And
planteaba,
Leonor from
haciendo
Chile spoke
referencia a
to
las
us
primeras
of
declaraciones de
the first
protección en los años 70, para
protection
recordar
laws in
algo
the 70s
esencial
and
y que hoy
reminded us
podría
of something
resultar obvio,
which
y
is
es que las
essential,
personas
which
con
today
problemas
seems
de salud
obvious,
mental
and that's that the
tienen
people
los
with
mismos
mental
derechos
health
humanos.
have the same human rights.
Este cambio de paradigma que
This
se refleja en la
paradigmatic
Convención sobre
change, which is
Discapacidad
reflected in
hacia
the
la unidad
conventions
social,
on disabilities
también
and
nos
social
recuerda
rights, reminds
el
us also
desafío de las
of the
legislaciones de la región
challenge
por
of
seguridad
the
en el transporte,
legislations in the
la
region,
revisión de los
the
códigos penales y
review
los
of the
temas de
criminal
criminalidad
codes
y
and the
medidas de seguridad.
punishability
Las normas ofensivas a la
laws
ética,
and standards
particularmente
of
cómo pueden haber todavía choques entre los sistemas
possible
de
shocks
interdicción,
between the
tutelas y
interdiction,
cuartelas con la
guardianship,
implementación de
and
los
other
estándares sobre
laws and the
consentimiento,
standards on consent aspects
así como las normas sobre
and the
voluntades
standards on the
anticipadas.
anticipated will.
Joy from
Joy
Barbados
from
was
Barbados.
telling us about this very important process of surpassing the Mental Health Act of 1985, which does not embrace the human rights-based approach, and recognizing that it does not go beyond the rights of, or goes beyond the client's rights in the framework of hospitalization. So there was no real mention to community. But in this process of creating a new act that does embrace rights, something very important that she highlighted is the importance of an open and wide process of consultation with relevant stakeholders in the process of working a new law. Gerardo Peña de México nos hablaba
Peña
de
from
la
Mexico spoke
alineación
to us
con
of
la
the
nueva
alignment with a
de
new
derechos
model,
humanos con salud mental y
including human rights,
discapacidad,
mental health, and
y cómo
disability.
esta
And
interesante,
the
es una norma muy
an,
interesante
an interesting
sobre la
aspect
manifestación tácita
of the
hospital
tacit
del
or written
consentimiento,
manifestation of consent
cómo la salud mental la
and
basa en la
mental
Constitución
health
y los tratados de
based
derechos humanos que
on
por
the
cierto
human
fueron
rights
incorporados en
treaties,
México a
which
partir de la
were
reforma
accepted in
constitucional.
Mexico after the
El
constitutional
enfoque basado en
reform.
la persona, no en
The
números, como
person-based
dice, hacia la
approach,
vida autónoma,
speaking of the
controles externos, punto
autonomous life and
importante,
the
el tema de los
external
mecanismos de
controls,
control,
the
controles
control
externos, además de
mechanism,
los
the
propios
external
servicios de
controls
salud,
aside from the
las
health
necesidades de
services themselves on the need for training he mentions some of the rights of this population and places the person in the center of the treatment and brings something which is fundamental, which is that the standard can be very good, but we have to implement it. And that's the challenge for our countries. And in all that, all I'd like to remind you of is the organization, the Pan American Health Organization's approach, which is the community, the recovery, the person-centered, and deinstitutionalization or dehospitalization. That's why the tools and work strategies bring up a series of norms that have already been mentioned today and which force us to work together intersectorally by eliminating coercive practices, particularly all those that we've already mentioned that violate the human rights, and create alternatives for mental health treatment in the community. Specifically, when speaking of today's webinar, the response from PAHO considers the need to support the countries in working in a coordinated manner with civil society, with the professional associations and other key sectors to promote regulatory and normative initiatives that promote positive practices in the field of human rights and mental health. To work with mental health with the human rights approach also implies caring for gender, cultural diversity, and culturally sensitive adaptations. And I'd like to end by saying that we should go to the courts, that the courts must also work with these perspectives in mind and these obligations. But let's focus on prevention and protection today. Thank you very much.
Muchísimas gracias,
Thank you
Olga,
very
por
much,
recoger
Olga,
esos
for
elementos clave.
collecting all
Muchísimas
these
gracias
key
a
elements,
todas y
and
todos
thank you to
por
all
la
of you
participación.
for participating.
Y bueno, como les
And
hemos puesto en el chat,
as
pueden acceder
we
a la
showed in the
grabación,
chat,
a
you can
las
access the
presentaciones,
recording and the
etcétera, en la
presentations and so
página
forth on
del
the
evento.
events
Y bueno, como
webpage.
siempre estaremos
And as usual,
compartiendo
we
más
will be sharing more
información.
information with
De
all
nuevo,
of you.
muchísimas gracias a todos
Again,
los
thank you all
panelistas y
very
las
much. The
panelistas
panelists, thank you very much.
y a la participación de
And
ustedes.
thank you all for
Un
for
saludo
participating.
a cada uno.
Special greetings to each and
Muchas
every one
gracias,
of you.
Carmen.
Thank you, Carmen.
Gracias a todos.
Thank you all.
Gracias. Hasta luego, que se ven.